Okay, good morning, everybody. You're very welcome here today to the NIPSA Health and Safety Conference. My name is Margaret Locker and I am the chairperson of the NIPSA Health and Safety Committee, and I will be chairing today's conference. Today is the 12th Annual Health and Safety Conference, and many of you might be wondering why we have been running a conference so soon after our conference was held in April. But as you're well aware, last year's conference, due to the outbreak of coronavirus, had to be delayed, and we had then decided that we would hold the conference on the 28th of April, which was International Workers' Memorial Day. But in order to align us back into our normal schedule for conference, we have moved the conference then back to October. We have a very exciting programme, and to help us deliver it, I am pleased to have with us today an esteemed panel of speakers who bring with them a wealth of knowledge on many of the issues that we as health and safety reps face. So I'd like to extend a very warm welcome to our keynote speakers and panelists. Diane Keys, who is the lead occupational therapy clinical specialist with the Belfast Trust. Neil Wallace, Employment Relations Manager with the Labour Relations Agency. Janet Newsham from the Manchester Hazards. Robert Kidd, Chief Executive of HSE&I. Alex Bunting, Director of Mental Health and Addiction Services at Inspire. Virgil McCann, who is a member of the NIPSA Health and Safety Committee and is also a long-standing health and safety rep. Carmel Gates, who is the newly appointed NIPSA General Secretary, and Brian Smith, who is the NIPSA President. I'm also pleased to announce the Chief Medical Officer, Professor Sir Michael McBride, will be joining us at 10:30. Professor Sir Michael McBride is content to take questions after his presentation and will be joining us for the 1-minute silence. You will note from the programme, we will be calling for a minute silence at 11 o'clock to remember those workers who have lost their lives due either to coronavirus or other work-related illnesses or injuries. The committee, as in many years gone past, has been very proactive in its work, trying to get vital information, guidance and support out to health and safety reps on the ground. There have been regular easings issued throughout the period of the coronavirus, including guidance on risk assessments, how to complete them, how to make sure that they're done correctly, the importance of ventilation and the fight against coronavirus and trying to prevent this transmission in enclosed areas, and the impact then of coronavirus on long COVID. While the committee helps reps with information that they may require in their duties and carrying out on the ground, they are a vital part of a trade union. And I would like to thank all those health and safety reps who have been working tirelessly throughout this pandemic to ensure that they have kept their workplaces safe. I'm going to move on here to the appointment of the scrutineers and the election of the Health and Safety Committee. In accordance with Conference Resolution number 51, adopted at the 2011 NIPSA conference, we will be conducting an election for the Health and Safety Committee at this conference. I am therefore seeking conference's endorsement of the appointment of Geraldine Alexander to act as scrutineer in conducting this election. And I would now call on Geraldine Alexander to outline the process for the election. Geraldine.
Thank you, Chairperson. Delegates, Geraldine Alexander, scrutineer, to make an announcement in relation to the election for the Health and Safety Committee. Delegates, can I refer you to the information I sent prior to the conference, which details the candidates nominated for election to the Health and Safety Committee? There will be one election for the Civil Service Group seats on the committee. You will note we received 6 nominations for the 8 seats from the Public Officers Group branches, and all 6 candidates have therefore been declared automatically elected. The 6 candidates declared elected are Fanula Anderson, Siobhan Duncan, Melanie Edmondson, John McKeegan, Catherine McNeil, and Raymond Nelson. This leaves a shortfall of 2, and in accordance with the election procedure, the shortfall from the Public Officers Group section shall now move to seats provided for those nominated from the Civil Service Group, so that we ensure that the 16 ordinary seats are filled. You will also note that nominations from the Civil Service Group has resulted in Ellis Boland being automatically declared elected by virtue of the minimum of 1 seat allocated to professional and technical grades, and Paul Pseudo Kelly automatically declared elected by virtue of the minimum of 1 seat allocated to the scientific and comparable grades. That leaves us with an election for the remaining 8 seats to ensure all 16 ordinary seats are filled. So delegates, you'll be entitled to vote for up to 8 candidates in the election. Please make sure you select yes for the candidates for whom you wish to cast your vote. Select no in the box against the candidates you do not wish to vote for. It's important you enter either yes or no in the box for each candidate. And to ensure the ballot is submitted, you must verify your selection and then press the submit button. If you vote yes for more than 8 candidates or the ballot paper is not submitted, then the ballot will be invalidated. The ballot will open at 10:30 a.m. and close at 12:30 p.m. And to vote delegates, you must use the election body link sent to you along with your unique key and password. And I know some of you have used the practice test on the system already. So hopefully you will be familiar with the process. Thank you.
Thank you, Charlie. I'd now like to call on Carmel. And Carmel is our newly appointed General Secretary, and she will be given the opening address to conference. Thank you, Carmel.
Margaret, thank you, and thanks to the committee for the invite. And it's a great privilege to be here. Can I also start by thanking Geraldine and Danielle and the staff of NIPSA headquarters for the work they have done in staging this event, which to bring all the elements together is no mean feat. I also want to thank you, our health and safety reps out on the ground, who have brought us through probably the most unprecedented and extraordinary time that any generation has lived through. I mean, outside of wars, it is difficult to imagine a more difficult time that trade unionists and workers have come through. And I want to thank you for the work you've done to keep us all safe in our workplaces. The last time that I addressed, this is my first time addressing you as General Secretary, and I'm very privileged to do so. The last time I spoke at a health and safety conference was in my position as NIPSA President. And at that time, it was just in the aftermath of the Grenfell fire, which I'm sure you all remember, of 2017, where we had just witnessed the deaths of 72 people, 72 working class people who lived in one of the richest London boroughs, working class people who paid the price for what the report into the event described as a terrible price for the catastrophic failure of government and industry. I would like to pose it differently. I think it was a failure based on greed and corruption of a capitalist system that puts more emphasis on profit than it does on the lives of ordinary people. And I have to say that it was difficult to imagine anything, but pre-COVID, it was difficult to imagine anything that was more stark in that regard. And then COVID came along, and we realized that a system that allows for the wanton, destruction of human lives was something that we could never have imagined. And it is the same thing in a bigger scale. We've had a report recently, I don't know if you've managed to see it, but the report by the Health and Safety Committee, the Science and Technology Committee, and a group of MPs in Westminster who have clearly highlighted that it was catastrophic failures of government that has led to the unnecessary deaths of thousands of ordinary people, thousands of people across these islands. We have 150,000 in the UK, and obviously billions worldwide. Now, obviously, government isn't responsible for the pandemic, and governments across the world are not responsible for the pandemic, but many of them are responsible for their failure to act in a timely fashion. And I have to say that some of this action or inaction was politically motivated. There is no doubt about that. And then, the report that I just mentioned doesn't even deal with some of the horrendous things that happened as a result of botched contracts and failures of tendering and contracts handed to friends and Tory donors who were in no position to address any of the needs that particularly of health service workers at that time. And all of these things are well known to all of us, and in my view are a damning indictment of a government that didn't care. So I think that one of the things that we have to call for now is a public inquiry. Maybe while we're still in the midst of it, we're never going to get the full answers, but there is no question that we need at the other side of this to have a genuine public inquiry, which involves trade unionists, which involves workers, and involve those who paid the highest price for what we have come through. As workers and trade unionists, we are the front line, and it is our job to hold governments to account. And I think that many trade unions have stood proud and done that. As health and safety reps on the ground, it is your job to hold the employers to account. And I want to commend you again and add my thanks to the points that Margaret made earlier, because I think the work that you've done on the ground has made sure that we have held our employers to account. In some areas, workers have had to go further with their employer, and we've been lucky, I suppose, in the public services to some degree, because not in every area, but in many areas, public service employers have managed to step up to take actions that they needed to take. But we've seen workers across many other areas who've had to take action themselves to withdraw their labour. We've seen postal workers in dairy having to say no because their conditions were not safe. We've had meat plant workers in Lurgan and elsewhere saying no because their conditions were not safe. We've had teachers and education workers having to take action and step up to their employer. And that's just some of the examples where workers and trade unionists have stepped in to protect workers. NIPSA has played its part in this, and you have all played your part in this. And I have to point back to the wonderful seminar that we had in last year, when we had the COVID seminar, and I'm sure all of you took part in that. I think you'll agree it was hugely beneficial. to the work of health and safety reps on the ground. We had input into, you know, what workers could do legally and what protections there existed within the law. But I think we've all realised that the law has been found wanting. And I know there was a bit of controversy when one of the senior officials in NIPSA indicated that, you know, if the law doesn't protect workers, then the law should be broken. And I think that caused a bit of consternation. But I have to say, I personally echo those views. If the law isn't up to protecting the lives of workers, then the law should be broken or the law should be changed. And often one follows the other. When workers and trade unionists have stepped up to break the law, what we have ended with is a change in the law. And in my view, that is as it should be. I think over recent times, we have realised, and I know Robert is going to be joining us, I'm not sure if he's here yet, but Robert Kidd, I think we have seen that the Health and Safety Executive has been woefully under-resourced to address all of the issues that we needed addressed over the last while. They didn't have the staff to do the workplace inspections. And as far as I know, not a single workplace was closed down because of COVID. And I think that is something going forward we need to address. We need to ensure that the Health and Safety Executive has the resources that it needs to do the work that it needs to do. I mean, it's difficult, and I'm not sure how long I've spoken for, but I don't want to keep you much longer. But what I do think that we now need to do is really consider what we do in future as workers and what action we take, because we've seen through this pandemic that the millionaires and the billionaires, the people who have already the grotesque wealth, have ended up with more. And I'm not just talking about the Jeff Bezos of the world who has made money because, you know, people are shopping online. I'm talking as well of the people who've made ridiculous profits on the health service on which we all rely, and the privatisation of the health service and privatisation of other services. And I think, you know, after this, the day of reckoning must come. And I think as workers and as trade unionists and NIPSA, we need to be in the front line of ensuring that day of reckoning and the wrath and anger of workers is let loose on those who brought us to where we are. We've seen, you know, the frontline workers, the poorest in society, are the people who have carried us through this pandemic. It's not the Jeff Bezos of the world or the others who are profiting by billions. It's ordinary workers who have taken us through this pandemic. And I think that points us to, you know, a new world, a different world. And I'm proud to say that NIPSA has as part of its commitment the fight for a socialist economy. And I think that is the only way that into the future we can protect workers, we can protect trade unionists, and we can all ensure that the wealth of society is used not, you know, for poor cladding on Grenfell and not for poor contracts and botched PPE equipment, but is used for the benefit of all of us and to keep all of us in society safe. So thank you again for all the work you do, because every single bit counts, every trip, slip and other hazards that you pick up in the workplace, from that right up to the permanent protection that we all enjoy from proper laws and proper health and safety. Every aspect of it is vital and is important. And I want to thank you for the work you do. And I hope you really enjoy the rest of the event and the rest of the conference. Thank you.
Thank you, Carmel. And I would just like to reiterate just what Carmel says, that, you know, the reps on the ground are the ones, you know, that are at the coalface, so to speak. And, you know, if we can't keep our workplaces safe unless you are there to do that work, and it is greatly appreciated, I'm sure, by all the people you work with and by the union itself. We have been waiting on Professor Sir Michael McBride attending, but he hasn't just come in yet. So I'm going to move on and bring in Helen Smith from the Labour Relations Agency. Helen is a Senior Employment Relations Manager in Advisory Services. She leads a team on promoting best employment practice, ensuring statutory compliance, and developing employment relations skills. She has been employed by the Labour Relations Agency for over 30 years and has worked in various roles across the organisation. Prior to taking up her current position, Helen worked for 14 years in dispute resolution and has in-depth hands-on practical knowledge of employment relations and employment law. She is a graduate of the Ulster University and holds a postgraduate diploma in human resource management. Helen is a chartered member of CIPD and an accredited mediator. She is an enthusiastic and dedicated professional who enjoys being part of a successful and productive team. I'd like to welcome Helen here today, and I'm going to hand over to you, Helen, for your presentation. Thank you.
Thank you, Margaret. Thank you very much, NIPSA, for inviting me along this morning to speak at your Health and Safety Conference on our guidance on COVID-19 vaccination and the workplace. Next slide, please. Thank you. The COVID-19 vaccine is not only a societal and health issue, it is also an employment issue. Employee health and safety has been a top priority for businesses during the pandemic, but the rollout of the COVID vaccine has, as expected, divided opinion, with some people reluctant to have the vaccine or refusing it. There are various reasons for this so-called vaccine hesitancy, including medical conditions, religious beliefs, or just fear and uncertainty. This requires careful and sensitive management and extends to how an employer approaches the issue of vaccination. Open and honest communication is key. Employers should proactively engage with employees and their workplace representatives to help employees make informed decisions regarding the vaccination and assist understanding by sharing accurate, credible, and reliable information. It is important that an employer listens to concerns with empathy, take those seriously, and respect the need for confidentiality. The guidance developed by the Labour Relations Agency distills some of the key messages that every employer will need to consider in the months ahead, including how to tackle some of the ethical, legal, and practical challenges for workplaces. Consider introducing a vaccination policy as a matter of choice rather than compulsion, bearing in mind the core principles of voluntary informed consent, reasonableness, and exceptions. The guide also includes a sample COVID vaccination policy that can be adapted to suit specific business needs, and there are signposts to additional information at appropriate stages throughout the document. Every employer has a legal obligation to ensure, so far as is reasonably practicable, the health, safety, and welfare at work of all employees, in particular through the provision and maintenance of a safe working environment. This duty gives employers justification for encouraging their employees to be vaccinated to not only protect themselves, but everyone else in the workplace. Employers also have a responsibility to take reasonable care of their own health and safety at work and follow safe working instructions. It is understandable that employers will want as many employees vaccinated as possible to help build protection, along with all other measures such as general cleaning and hygiene, social distancing, wearing of face coverings, testing, ventilation, and so on, in terms of having a COVID secure workplace. Risk assessments must be kept under continual review. It must be remembered that the vaccine is just one measure of protection, and employers must follow public health advice and comply with the relevant regulations as they continue to apply. Trade union reps have a major role to play in this context and can make a significant difference in the provision of support, educating and informing members, negotiating with employers, steps that can be taken to best protect the health and safety of the workforce. Where an employer decides to introduce a COVID vaccination policy, this should be done in consultation with the recognised trade union and reviewed periodically. We will all be familiar with the by now well-coined no jab, no job approach. Although the government has not mandated having the jab subject to certain sectors, in the care sector in England, for example, we know that legislation is coming into force in November, so that unless somebody has a medical exemption, they are required to have a full vaccination. But in all other sectors, it's much better to encourage people than to force them. However, some employers have been hitting the headlines by making vaccinations compulsory for current and future employees, potentially landing themselves in legal hot water. Pimlico Plumbers, a London-based plumbing firm, for example, was one of the first organisations to publicly state its intentions to mandate vaccines and has set a deadline of January 2022 for all their employees to have been vaccinated or face dismissal. With the debate still shrouded in uncertainty, what are the potential risks of a no jab, no job policy for when we return to offices? I will cover these briefly. Mandatory vaccination could give rise to claims of unfair or constructive dismissal. This may be particularly risky whether an employee is dismissed for failing to have a vaccination or resigns in response to an employer's attempt to change the contract of employment or make the vaccination an occupational requirement unilaterally. Any approach must be justified by the particular circumstances, as the hurdle is likely to be high. There must be clear evidence of the benefit and need to vaccinate the workplace. In the case of dismissal, the management instruction must be reasonable and the employee's refusal must be unreasonable. And it goes without saying that to defend unfair dismissal, the employer must ensure a reasonable and fair process has been followed, and the employee will require the necessary length of service to challenge the decision. Such a policy could be discriminatory for employees who have underlying medical concerns, are pregnant, or hold a religious belief that prevent them from being vaccinated. An employer will therefore need to have an objectively justifiable reason for requiring vaccinations, and most workplaces are unlikely to meet this requirement, where other COVID protection measures can be used, for example, social distancing measures or working from home. Adding a clause into contracts of employment is likely to be equally divisive and potentially discriminatory. So specialist legal advice should be taken ahead of going down this route. Each case will be fact-specific. Along with the employment law risks, an employee's trust in the employer may be affected if they are required to accept a vaccination against their wishes. Equally, the risk of unsettling employees with such an inflexible policy can have a negative impact on a company's culture and lead to increased resignations. Whether an employee has been vaccinated is their private health information, and therefore special category data protections apply. Before deciding to collect employees' vaccination status, employers should be clear about what they are trying to achieve and how recording vaccination status will help this. The reason for recording vaccination status must be clear, compelling, and communicated to employees. The collection of information must not result in any unfair or unjustified treatment of employees, and it should only be used for the purposes they would reasonably expect. Employers must treat staff fairly, and if the collection of vaccination status is likely to have a negative consequence for an employee, an employer must be able to justify it. Whilst the vaccine is safe for use, in the unlikely event that an employee had an adverse reaction where an employer made it a mandatory requirement, may place an employer at risk of a personal injury claim or claims in potential jurisdictions not yet tested by the courts and tribunals, such as philosophical belief. Next slide, please. And yes, that's lovely. Thank you. And finally, if you or your members have an employment-related query, then please do contact our Workplace Information Service. The details are on the slide. Thank you for your time.
Thank you very much, Helen. And that was very informative. Do any delegates have any questions for Helen? Now, you can either indicate by raising your hand, or if you don't want to speak, you can put your question in the chat. Helen, it looks like you've answered all their questions. So it does. Okay, delegates, are you happy enough? Sorry, go ahead.
Margaret, I thought one person had just put their hand up. They must have taken it down there, so they have.
Sorry, I have a one-way question here from one of the delegates. So what is the requirement to social distance at work now the restrictions have been eased?
That's something, Margaret, I will have to check. It's not something I have an answer to right at this time, but I will certainly check and come back to John as soon as I can.
Thank you very much. One attendee.
There's a question from John McKeegan.
That was the question.
Oh, that was it. Sorry. Right. Thank you.
There's a raised hand as well. I just can't find it. Hang on. Oh, Brendan O'Reilly. There might be a wee bit of a delay, Brendan, just bringing you into the panelist room, so just give it a wee second. And there you are there. Brendan, you're on silent.
Thank you very much. Firstly, thank you very much for that presentation, Helen. It was very good, very informative. Just regarding to the likes of a vaccination policy, obviously, as you said, it would have to be say on a voluntary basis. Now, the flip side of that is a lot of staff would be concerned that not enough people would be taking up the vaccine. What sort of angle would you take to allay those people's fears, and obviously as well to encourage as many as you could to avail of the vaccine if they are able to? Thank you.
Thank you, Brendan. I think it's very important that an employer has those discussions with employees, and it's very important that they listen, they take all of those concerns on board and take them seriously and respect the need for confidentiality. But they have to look at the bigger picture, and I think the important thing for employers is that they must continue to operate within the current government guidance and look at other areas. So, vaccine, as I've said, is only one measure of protection. So if there are other alternatives to that, well, then an employer should be exploring those.
Give me a second here. So Helen, there's just a wee thing here. So as part of the risk assessment process, we have stipulated 1 metre distancing at the minimum distance, as the minimum distance. This is applied throughout the organisation. Where this is not practicable to do so, for unavoidable short-term close working, the wearing of PPE is required in the form, not non-PPE face masks, but proper face masks.
That's very helpful, Paul. And again, that's maybe something certainly that I will check, but also Robert Kidd from the Health and Safety Executive will probably have some detail on that as well. So it may well be useful for Robert to pick up on that as part of his discussions later, but I will certainly explore if there are any other variations to that, but certainly I would have thought that would have been the minimum distance at this stage, but certainly I'll come back to that.
And just one other one, Helen, is that where employees have the availability to work from home, should that be maintained?
Again, it will very much come down to those discussions with the employer. And the employer will look at the bigger scale of things and what people they need and what resources they need within the office. However, you know, working from home is another alternative. But again, you have to look at the bigger picture. So, you know, an employer will have to look at what resources they need within the office and all, of course, all of the other safety measures that go along with that.
Yeah, thank you, Helen. Okay, we've no further questions for Helen. I'd just like to thank you, Helen, for your very informative presentation. And I'm sure everybody will be glad for that contribution to end the conference today. Thank you. Okay, so now I'm going to invite Professor Sir Michael McBride, as many of you will know, is the Chief Medical Officer for Northern Ireland. Sir Michael?
Well, good morning, everyone. Good morning, everyone. Good morning, Margaret, and thank you for your invitation to speak this morning. Just before starting, I have to comment on Fergal's face covering. I have to say it's the most colourful I've seen in quite some time. I don't know if everyone can see it on their screen, but it does appear to be the red flag of NIPSA flying proudly there. So congratulations on that, Fergal. I just wanted to take a short time to speak with you this morning on the issue of the vaccination programme in Northern Ireland. We all know, we've all experienced in our personal lives and our work lives that the coronavirus pandemic has delivered a very significant shock to the world, to the United Kingdom, to these islands, and more specifically to us here in Northern Ireland. And the measures that we have had to take, to put in place, the steps that we've had to take to control the virus have reached deep into our lives, affecting people's income, their job security, their social contacts, our family lives, factors that are essential to healthy lives. And I think we have all experienced those impacts at a variety of levels. I think it's also fair to say that the pandemic, as all pandemics, has exposed again the huge inequalities that we see across society, where reports published by our public health agency here in Northern Ireland demonstrated the disproportionate impact that COVID has had on those from lower socioeconomic groups, those working in manual or unskilled jobs, and the disproportionate impact that has had on individuals in terms of acquiring COVID infection, and sadly and tragically, some people dying with COVID. So it's a stark reminder to us all that we have much work to do in terms of improving the health of the entire population, and specifically improving the life opportunities of everyone in society. Over the last almost now 2 years, the public health workforce and government have had to reshape their work in an effort to contain the infection and to protect the most vulnerable in society. And we have seen some remarkable examples of our strong sense of community in Northern Ireland, of people coming together, of communities coming together, of the community and voluntary sector coming together. And many, many people have made many sacrifices in order to help curb the worst effects of the pandemic. Those delivering public services in Northern Ireland have been hit hard by the pandemic, but their members can, I believe, be very proud that despite the dangers, despite the restrictions, they still have continued to deliver vital services to those who need it the most. While we have seen much adaptation, much innovation, and I think much to be proud of as we adapted how we provided services, how we provided health and social care services, how we provided public services in an accessible way, sometimes implementing change that would have otherwise taken many, many years to put in place. One of the very important and key positive outcomes from the pandemic has been the rapid introduction of the COVID-19 vaccination program, which Helen has just touched on. Following accelerated research and development and extensive testing, the UK was the first country in the world to introduce a COVID-19 vaccination program. And this began on the 8th of December 2020 and has helped to provide the much needed protection to those most at risk of illness or death from COVID-19. I remember very vividly, I was present that morning at the vaccination centre in the Royal Victoria Hospital and witnessed the palpable sense of relief and hope that the programme generated when Joanne Sloan, the sister in charge of the COVID vaccination centre for the Belfast Health and Social Care Trust, became the first person to be vaccinated in Northern Ireland. And since then, well over 2.5 million doses have now been administered here. The programme has been based on the recommendations from the Joint Committee on Vaccination and Immunisation. And in Northern Ireland, we follow the JCVI advice, as in all other parts of these islands, in rolling the programme out to those considered most at risk before moving through the age cohorts. The programme in Northern Ireland has been an outstanding success and has helped us make very significant strides to restoring again the more normal life that we all want to see. It has been by far the biggest mass vaccination programme in our history and has been implemented with remarkable speed. The programme itself has thrown up many, many logistical challenges, from handling the vaccine that had to be stored at ultra-low temperatures to establishing mass vaccination centres that could safely vaccinate thousands of people per day, through to recruiting vaccinators, bringing back volunteers, people who had retired from the service, who give freely and willingly of their time to contribute to this collective effort. I've been very fortunate to visit many vaccination sites right across Northern Ireland, some small, some large, and some enormous, such as the SSE Arena. And at each of them, I witnessed at firsthand the dedication and commitment shown by all of those involved in the process. From those in the car parks directing traffic, to security, to the helpers at the doors guiding people through, to the vaccinators on the front line. Of course, I have to mention all the backroom staff providing the admin support, the IT knowledge, the essential pharmacy input, as well as the cleaners and the canteen staff, keeping the wheels turning, but not only keeping the wheels turning, as I experienced in the SSE Arena, and I won't name individuals, those with the humour, those that kept everybody else going when everybody else was flagging. It was a remarkable collective and team effort, and the sense of spirit as I was at the closing event in the SSE Arena, and then some time later at the South Lakes Centre, the team spirit and everyone working for a common purpose, everyone coming together, everyone playing an equally important role was absolutely quite remarkable to experience and to witness. And I think we can be rightly proud of all of those who were involved in delivering the programme. Now, some nearly 90% of the adult population have received the first dose of the vaccine. Almost 84% have received both doses. However, there is still more work to be done. And I would encourage those who so far have not taken up the offer of vaccine to do so, to ensure that we maximise the overall uptake rates, particularly in the youngest age groups. The more of us are vaccinated, the safer we all are from the impact of COVID. We are all deeply concerned, I am deeply concerned about the immense pressures on our health and care system. And getting vaccinated is the single most important thing a person can do to help protect themselves and those around them. It can make a huge difference for the health service and for its staff by reducing the number of patients in hospital and in particular needing treatment in ICU. Every 1% more of the population that we vaccinate will result in a 10% reduction in the number of people requiring admission to hospital and a 10% reduction in people requiring admission to intensive care. And that means those beds, those hospital beds, those ICU beds are available then for those individuals who need time, critical surgery, cancer treatment, and other urgent intervention. The recently published statistics of those in ICU once again demonstrated the importance of getting as many people as possible vaccinated and very much underline the effectiveness of the COVID-19 vaccination. Quite simply, vaccination alters the odds in your favour in terms of protection against hospitalisation and death. We know that no vaccination, and the COVID vaccinations are no different, provides 100% protection, but it does greatly reduce the risk of catching the virus and more so increases and reduces the effectiveness of the vaccine, reduces the impact of those unlucky enough to get infected by reducing the risk of hospitalization and reducing the risk of admission to ICU and reducing the risk of death. We know that those of us who are older, those of us who have underlying health conditions, those of us who are overweight, those of us who are male are at greater risk. It is vitally important that any of you today on this call or any of your friends or colleagues on this call today that haven't had the vaccine, that you have that conversation with them about the benefits to themselves, to those around them, their work colleagues, those they work with, of getting the vaccine. Why would any of us wish to take the risk of not getting the vaccine, ending up in hospital, or ending up in intensive care, or worse still, dying from this virus? There will, however, sadly continue to be some people who will lose their lives to the virus, despite being doubly vaccinated. But we can all help to reduce the risk of this happening by continuing to take and follow the basic public health advice around face coverings, around minimizing our contacts, about being careful in the work environment, and indeed following the regularly updated advice on NI Direct, which is specific to each of the sectors, and following the public health advice available on the public health website. Rolling out the COVID-19 vaccination program has required a huge amount of hard work and dedication. So to all involved, please accept my sincere gratitude. I appreciate the long hours of work to ensure that we could provide the people of Northern Ireland with the best available protection from this virus. This winter will be challenging. We anticipate that we may see a more severe flu season than normal. So we're working hard to ensure that those most at risk are protected against COVID and influenza this winter. As you will have heard, JCVI has issued advice in relation to a booster programme. And as with the original booster programme, the booster programme has initially started with care homes, residents and staff, as well as frontline health and social care workers. In addition, everyone aged 50 and over will be eligible for a booster jab once 6 months has passed from the date of their second COVID vaccination dose. Eligibility also covers those aged 16 to 49 years with underlying conditions that put them at higher risk of severe COVID, adult carers, adult household contacts of those who are immunosuppressed. And again, relevant to the question that just come up in the chat box, not enough time has passed to clearly understand protection levels 6 months after completion of the primary course in all persons. Therefore, the JCVI has taken a precautionary approach, advising that it is preferable to ensure protection is maintained at a high level throughout the winter months in adults who are more vulnerable to severe disease. So this is primarily, this booster campaign is primarily about protecting those who are at more risk of more severe disease. That is the advice of JCVI and differs slightly to the approach which we took in the first phase of the vaccination, when it was also about ensuring the continuity of health and social care services. To be clear, it is not yet established whether recurrent boosters, that's booster doses every year, will be required in the long term, and therefore this programme relates only to the winter of 21-22. The booster programme itself will be primarily delivered by GPs and community pharmacy. Trusts are vaccinating care home residents and their own frontline staff, while community pharmacy will initially be vaccinating non-trust employed frontline healthcare staff before moving on to the general public. GPs will be starting to invite those patients who are now beyond the 6 month period from their second dose to receive their booster, and indeed some have started. And GPs have the option of providing COVID booster and flu jabs together or separately. The cumulative impact of COVID on our health service, social care, wider society will take many months to quantify and understand. We're already living with some of the consequences of COVID. We're living with some of the consequences of some of the steps that we had to take to contain the spread of the virus, some of the consequences for our children who were unable to attend school, some of the levels of increased anxiety and depression and pressures on our mental health services that we are seeing. There is no doubt that this has been a very challenging time, and it, as I say, will be many months before we see the full consequences of that, not just measured in terms of people waiting even longer for treatment and care, but also the impact that it has had on staff right across health and care services over relentless pressure over the last 2 months, or last 24 months. We do not know, however, how worse a position we would be in had we not had the vaccination programme against COVID. So I'd like to close by paying tribute to all workers, including the health and social care staff who've worked tirelessly to keep us all safe, continue to deliver our vaccination programme. My heartfelt thanks goes to all those involved in delivering the programme right across Northern Ireland and for the continued work throughout the health service. Thank you very much indeed.
Thank you very much, Professor McBride. I'd just like to see if anybody has any quick questions for the Professor before we go into the 1 minute silence.
Yeah, I think I picked up on that question, Geraldine, during my presentation. I mean, the primary camp vaccine rollout was also around maintaining the integrity of health and social care services. There's still a lot of unknown about the requirement for booster vaccinations, as I've said, and JCVI has recommended boosters largely to protect those most at risk, and therefore it's those frontline staff who are working with those most at risk at this point in time. Now, JCVI will be again looking at those, no doubt, at those that they haven't currently provided advice around booster doses, and that information will become available in due course, and that will undoubtedly involve looking at those in younger age cohorts, or indeed those who don't have underlying health conditions, as to whether or not booster vaccination may be required in that age group, in those age cohorts or groups. But that is not something that they recommend at this time, and their advice is in relation to specifically those frontline staff working directly with vulnerable patients.
Michael, just there, someone has asked that now that the big vaccination centres have closed, where do you go then for your vaccine? Yeah,
well, firstly, go on the NI Direct. You will see that there are probably 130 plus and increasing all of the time community pharmacies which are offering first doses to individuals. I was in Bangor on Friday just past, where they were actually running an initiative of open to all comers for first doses. And we will see a number of those initiatives in community pharmacy, I have no doubt, coming up. But you can book a first dose with your local community pharmacy. So go on the NI Direct website, you'll see there a list of the pharmacies, and you can book directly with community pharmacy.
Just one more question was that if you received a particular vaccine initially in your double vaccination, when you receive your booster, does it have to be the same vaccine?
No, the JCVI have published advice, and it is on their website, and it's also on it'll be on the NI Direct website. What they are recommending that for booster doses, that what we receive is one of the messenger RNA vaccines, irrespective of whatever we received in our primary dose. So for those of us like myself who received the AZ vaccine, I will be receiving either a dose of Pfizer, which is one of the messenger RNA vaccines, as a booster, because I'm approaching nearly, what age am I? Actually, I am 59 years of age, or a half dose of the Moderna vaccine, which is also a messenger RNA vaccine. So irrespective of which your primary vaccine was, whether it was Pfizer, or it was Moderna, or AZ, you will get a dose of either Pfizer or the Moderna, half dose Moderna as your booster dose.
Just been asking there, so due to the increase of transmission in primary school children, will the department be looking at, as in America, where they're testing a third of the adult dose for children?
Obviously, the Joint Committee on Vaccination and Immunisation is the advisory body to governments right across the United Kingdom on the rollout of all vaccines, all childhood vaccines, and indeed adult vaccines. They are looking at the evidence from around the world, including the safety and efficacy of the vaccine in children. They have not provided advice on that, as you know. What they have provided advice is on those aged 16 to 17 to get their first dose, while they await data on second doses. And JCVI recommended to government that chief medical officers were asked about children aged 12 to 15. And we were clear that the benefits on top of the marginal benefits in terms of health benefits directly to 12 to 15-year-olds, but the benefits in terms of minimizing disrupted education, etc., and other issues which we all recognize are really important, that children spend time in school. In addition, there was a public health case to be made for children aged 12 to 15 receiving the vaccine. Now, JCVI will continue to look at the evidence as it accumulates globally around vaccinating children at a younger age cohort. That's not something that they have recommended at this time, but I have no doubt that it is something that they may wish to comment on in the weeks and months ahead.
Okay. Professor McBride, I'd like to ask you, along with myself, to lead us into the 1 minute silence, and for all workers who have lost their lives while carrying out activities in association with their work. Thank you, conference. Professor McBride, I'd like to thank you very much for taking the time out of your busy schedule today to attend our conference and for the contribution that you have made.
No, well, look, Margaret, thank you, and Geraldine, thank you very much indeed for the kind invitation. And as long as I get one of Fergal's masks, which I think will be a collector's item in future on eBay, I have no doubt, then as I say, the time will have been well spent. No, look, again, just to thank hugely everyone for their collective efforts. I think this has been, we keep using the word unprecedented. I don't think any of us, certainly I haven't experienced anything like this in my professional life. And we could not have got as far as we have without that huge collective effort of all workers across all of public services here in Northern Ireland. It was humbling, deeply moving at times to experience and hear of some of those sacrifices and the effort that has been made. So a huge thank you to you and to all of your members and all those attending the conference.
Thank you again. Okay, thank you. Cheerio.
Bye.
Conference, we're going to move now to a tea break. Now, before you go on your tea break, you don't have to actually sign out of today's conference. If you just turn off your camera and turn off your microphone, and due to the run-on time, I'm going to give you till 11:20 to come back in again. So, but you would need to be back on time. So just remember, don't exit the conference. Just turn off your camera and your microphone. Okay, delegates, and I'll see you at 11:20. Thank you. Welcome back, everybody. Just before I move into the panel session, I'd just like to remind everybody that the ballot is open for voting for the new Health and Safety Committee, and it will remain open until 12:30. So please ensure that you cast your vote between now and 12:30. Thank you, delegates. So moving on, we're going to move into the first panel discussion of today. And this panel discussion is going to look at long COVID. We have several speakers who are going to give a short presentation, and we're going to start with our own Fergal McCann, and he is currently a member of the NIPSA Health and Safety Committee and has been a health and safety rep for many years. Diane Keys, who's the lead occupational therapy clinical specialist at the Belfast Health and Social Care Trust. Diane is a qualified occupational therapist, and before working in a wide range of clinical settings locally, regionally and internationally prior to commencing her role in occupational health, Diane's role has developed significantly over the years, specialising as a successful health and wellbeing champion for staff with long-term health conditions. March 2020 saw the arrival of COVID, and as a senior manager within occupational health, Diane established a COVID-19 advice line for Belfast Trust and independent sector workers. This led to the setup and establishment of a COVID-19 PCR results team, a contact tracing team, and a long COVID team, all of which are managed and supported by Diane. We'll also be welcoming Neil Wallace from the Labour Relations Agency. Neil is a senior manager with the Labour Relations Agency. He currently leads the Good Employment Practice Service of the agency and has responsibility for the agency's information phone service, the Workplace Information Service. Neil has held various roles within LRA for the past 7 years, and prior to this, he was a trade union official and in a previous life, a radiation therapist working with the HSCNI and the Health Service Executive. We'll also be welcoming Janet Newsham from Manchester Hazards, and Janet is the acting chair of UK Hazards Campaign and organiser of UK Hazards Conference and coordinator at the Greater Manchester Hazard Centre. She previously worked for UCU on a ULF project and employed as a lecturer in trade union education at Manchester and Preston colleges. She has been a trade union activist for nearly 40 years, branch officer and workplace representative, and served on the union's executive committee. She has also been a lay member on the employment tribunals in Manchester for 20 years. So I'd like to start off then by welcoming Fergal to start our first panel for today on long COVID. Thank you, Fergal.
I suppose I should start by thanking Professor McBride for his comments on the mask. It's one that I just made myself. So thanks very much, Professor McBride. Colleagues, comrades, panelists, I'd like to thank you for the opportunity to present my story of long COVID personal journey. I tested positive for COVID-19 on the 31st of January 21 after my third test in 10 days and after beginning isolation as a close contact. As a positive case, I began isolating in my room at home away from others in the house. My condition became worse, and after 7 days, I contacted the out-of-hours doctor, went to the Mater Hospital A&E, and was admitted on the 7th of February. I spent the next 14 days in a COVID ward. You put up the next slide, please. I remember the events of those days as vividly as I do my childhood experiences. To me, it was just like the fear and horror of the early 70s of war-torn Belfast. Every night in hospital was like a nightmare of flashing lights and siren-like alarms from the medical instruments, and the constant gush of oxygen being forced into my lungs through a mask so tightly strapped to my face that it cut into the bridge of my nose and drew blood. The noise surrounded me as the alarms and flashing lights of other people's instruments in the ward sounded out in a symphony of confused notes. Trying to create a melody gave me something to focus on. You put up the next slide, please. Though dazed and exhausted, I could see the blurred figures of medical personnel fussing around my bed, taking blood, injecting me with drugs, taking blood pressure and blood oxygen level and temperature readings, all the while speaking in stage whisper voices that betrayed their concern for my condition. Many times I heard them whisper about whether to make the decision to transfer me to the Royal Victoria Hospital Intensive Care Unit. I later learned that they had contacted my wife, told her to expect the worst and that I may not survive. You put up the next slide, please. In my mind, I was living the horror endured by my friend, retired NIPSA colleague John Gracie, who had recently lost his life to COVID in an ISU ward. I remember sucking the oxygen as deep as I could into my lungs, imagining it pushing its way to the bottom again and again. As the days went on, my efforts, and especially those of the hero-like medical personnel, consultants, doctors, nurses, and care assistants, won through. And gradually, my oxygen intake was reduced. I was getting better and was moved into another ward, and then another, as my recuperation staged its way towards my release. Put up the next slide, please. I have never cried like I did on the day I went home. My nightmare was over, or so I thought. Almost 8 months later, I am still suffering from this most debilitating disease, or at least its after effects, known collectively as long COVID, also known as post-COVID condition or post-acute sequelae of SARS-CoV-2 infection. Although there's no definitive diagnosis for this condition, I have been referred to a long COVID clinic, which was set up to treat those suffering from the post-effects of having had COVID-19. I've been affected in so many ways that it's hard to recognize the symptoms as a collective response to my illness. After the tears of my release, I found myself to be an emotional wreck, crying at the most awkward times, or for the least or no reason, being moody and angry, being funny then sarcastic, swinging up and down. My inability to manage my emotions when embarrassing or swamped by the waves of anxiety and depression that sweep over me like a blanket. Coupled with a fuzziness or fog in my head, my concentration levels blur as I struggle to focus on the most menial of tasks at times. I am caught in a spiral of exhaustion, sleeping little at night, and becoming comatose in a chair for perhaps an hour at a time, still not enough to compensate for lost sleep. I struggle to go into work, deliberately having asked to work from the office because at home the lure of unconsciousness looms. I would otherwise fear for my sanity. My physical inabilities have been exponentially affected also. The strength in my legs has diminished so badly that short walks, even with a stick, are extremely painful on my muscles and joints, and my breathing is extremely laboured. I've been prescribed bone density tablets and been tested for pulmonary function. I've had lung x-rays and been referred to physiotherapy classes via Zoom. My chest, throat and voice box become more and more laboured throughout the day, to the point that I lose my voice almost entirely. These are my symptoms, but long COVID sufferers are affected by a wide range of these and others. Can you put up the next slide, please? In the same way doctors have learned from treating those that had this illness before me, I hope my experience will help others so that in future we can overcome this illness. In order to try to give back to the treatment they received by medical teams, and in order to make that future happen, I have become involved in 2 research studies. The first is the post-hospitalisation COVID-19 study, FOSP-COVID, based in Leicester University, and rolled out among hospitals UK-wide. This is a long-term research study involving 10,000 patients who have been hospitalised with COVID-19. It is hoped that over the course of a year, clinical assessments will track patients to gain a comprehensive picture of the impact COVID-19 has had on longer-term health outcomes across the UK. The FOSP-COVID team will then develop trials of new strategies for clinical care, including personalised treatments for groups of patients based on the particular disease characteristics they show as a result of having had COVID-19 to improve their long-term health. The second is an online survey on behalf of the World Health Organization and the Post-COVID Condition Core Outcome Set study group that are attempting to create a core set of outcomes that should be evaluated in all research studies and in clinical care for people with long COVID. This involves an international team of health professionals, researchers, and people with lived experience of long COVID. Their goal is to improve research and clinical care by identifying the most important outcomes of long COVID through collecting the views of different people from around the world. Put up the next slide, please. The lack of understanding of this condition presents a huge difficulty in workplaces, with many employers ignorant of, unsure, or unwilling to accommodate reasonable adjustments for symptoms of what they see as an undiagnosed illness. The advice from ACAS is, long COVID is still a new illness and it may take time to understand it fully. It can affect a person's day-to-day activities, and it's currently understood that it can last or come and go for several months. The effects of long COVID could also cause other impairments. It's a good idea for the employer to focus on the reasonable adjustments they can make rather than trying to work out if an employee's condition is a disability. From April, my employer has accommodated me for attending 13 hospital appointments and have given permission for me to attend a twice-weekly 12-week physio course starting in November. So far, I've been lucky as my employer has accommodated so many of my treatment appointments, but I fear for many other sufferers. As union health and safety representatives, we need to be aware of the needs of those suffering from long COVID and ensure employers allow them the time to recover from that. Thank you.
Thank you, Fergal, for personal accounts. Okay, I'd like to move on then to Diane Keys. You're very welcome, Diane. Thank you very much. If we lead into your presentation, okay?
Thank you very much, and thank you very much for the invite to speak today. And Fergal, I think you've set the scene absolutely perfectly for my presentation, and I hope a lot of the points that you've very eloquently made will be reflected in my presentation. So I'm going to talk about long COVID and the road to recovery. Next slide, please. So the definition, the clinical definition of long COVID or post-COVID syndrome, as it is becoming known as, categorizes symptoms by duration primarily. So acute COVID are symptoms experienced up to 4 weeks, and ongoing symptoms then are the next level where symptoms are experienced between 4 and 12 weeks. And then post-COVID syndrome is defined as individuals experiencing symptoms continuing more than 12 weeks. It should be noted that a high percentage of symptoms do resolve within the 8 to 12 week period post-COVID infection. However, there are a number of people who do experience those longer term symptoms. Next slide, please. So statistically, early indications estimate that 10% of those testing positive for COVID will go on to develop symptoms of post-COVID syndrome. Now, however, there's emerging evidence and it suggests a figure may be closer to about 20%. But again, it's relatively unknown and there's a high degree of underreporting at this point in time. Next slide. Within Northern Ireland statistics, I think this underreporting is quite evident. It really shows that Northern Ireland self-reported long COVID is a lot less than that self-reported within the rest of the UK. And we don't know really why this is. I mean, this is an old report. It dates back to April. There's a new report due out in November. So it'll be interesting to see how the statistics compare. But certainly the people that we see within our clinic really have tried to do what they call push through it. And I think it's a really Northern Ireland culture that we try and overcome and try and push through and get through the symptoms and don't really recognise them at an early point in time where we can maybe put in some preventative measures. Next slide, please. So symptoms of long COVID. You know, in the post-COVID syndrome clinics, we see a very wide range of symptoms. By the end of September 21, we had assessed over 200 staff members. Our unexpected findings really were the wide range of symptoms and really what Fergal has talked about. The symptoms are hugely wide ranging and there's a complexity in the combination of symptoms experienced. Additionally, many people have underlying health conditions also prior to contracting COVID. And as a result, these symptoms can increase in severity as a result of a new COVID diagnosis. And really, this is all adding extra layers of complexity whenever we start looking at recovery. Next slide, please. It's important to realise that this is a multi-system attack. Our body has protective specialist cells in all of our major organs, and COVID has the ability to invade these organs despite the specialist cells that are present. And as a result, current research indicates that there may be 205 different symptoms related to post-COVID syndrome related to 10 different bodily systems. Some people experience a single symptom, but it can generally be a very atypical presentation, so not something that we normally expect to see with that particular symptom. We are aware that a lot of people will go through a lot of medical investigation, and again, no abnormalities can be detected, and it's this atypical presentation that we need to learn more about. It's becoming apparent that neurological and cognitive symptoms do appear to last longer than other symptoms. There is emerging evidence that there's organ impairment involved, but it's not known if this impairment is reversible at this stage or not. And we do know that post-COVID syndrome statistically appears to affect more females than males. Next slide, please. The main symptoms, I mean, a lot of this syndrome is largely misunderstood, as Fergal had said. And we do know that post-COVID syndrome is very debilitating and definitely impacts day-to-day functioning very significantly. Many of you will be familiar with the main symptoms of breathlessness, chest tightness, anxiety, chronic fatigue and headaches, just to name a few, and that's reflected in Fergal's presentation as well in his lived experience. It's important that we recognise the symptoms and that they are connected and often feed into each other. We would have a staff presenting themselves not eating maybe the right food because maybe their taste or smell has been affected. This is likely to impact on fatigue levels and then lead to brain fog and low mood and heightened anxiety. We know that the physical, psychological, social, environmental and cognitive factors are all affected due to long COVID. Next slide, please. So our solution here in the Belfast Trust was to provide personalised recovery plans for individuals. We were very aware that this syndrome was very fluctuating and individuals were subjected to quite frequent relapses within their recovery journey. So, and our aim was really to enable people to self-manage their health and well-being. We provided a holistic assessment rather than looking at each syndrome or each presentation or each syndrome really separately. So we're not looking at it on a symptom to symptom approach, we're looking at it holistically. Our aim is to improve functionability to ultimately enable that person to return to work, but we also want to build up their confidence to self-manage this long-term health condition. Next slide, please. The Royal College of Occupational Therapists have a very simple but very effective recovery strategy, and that's the 3 Ps, and it's something that a lot of people can relate to. The importance of planning, pacing and prioritising is very vitally important in recovery. In our experience, staff are prioritising work over and above their home life, often going to bed very early, around 6 or 7 o'clock, absolutely exhausted, not taking the time to eat or cook maybe a meal. They are waking up the next day feeling very fatigued, totally unrested, despite having slept for a prolonged period of time. This is unsustainable in the longer term and is highly likely to lead to a relapse, which certainly is our experience. And this has a significant impact on that individual's hope for recovery in the longer term. And that's something that we're really trying to effectively manage by using the 3 Ps, planning, pacing and prioritising, and implementing those with all aspects of life. Next slide, please. So our recovery plans, we have a rehab, we have a real luxury of being able to offer rehabilitation to staff. We have about 81% of our referrals have a self-directed rehab plan, really utilising e-health resources with some additional one-to-one therapy intervention. We also have access to respiratory rehabilitation and horticultural rehab, where we're trying to really improve functional ability through very targeted specific rehab programs. We also have multidisciplinary rehab. Fergal had mentioned the mental health impact, especially individuals who have been hospitalised, that mental health support is vitally important. And lastly, we also offer wellness calls to support individuals, really to help them implement the self-directed rehab plan that we have provided. Next slide, please. Returning to work is a very complex issue. And in our experience, there's a very high level of relapse following return to work and a very high dropout rate following return to work. Many return to work too early because individuals feel they can manage on a day-to-day basis, but whenever they enter the workplace, it's a very different challenge. And part of that is due to the psychological and cognitive as well as the physical demands of the workplace. we really want to ensure that we reduce the impact returning to work has on an individual's recovery. So following the provision of our recovery plans, 62% of our staff have successfully returned to work and remained in work because there's a return to work plan in place. We find that managing the expectation of the individual and the manager is vitally important. Staff are often very keen to return to work, and we are keen to support that, but it must be at the right time. We're finding that a lot of people require an extended phased return to work in order to set them up for success. We're often recommending the staff do not return to their full working hours initially, but they maybe have the expectation of being able to achieve maybe 50, 60 or 70% of their total working hours by the end of their phased return. And it's really important that we look at the suitability of the work. We may need to look we frequently do look at adjustments to the work roles, saying to people, like, maybe you shouldn't do this part of your role, but you can concentrate on these other elements, and then just gradually build up their full return to work over a very gradual period of time. Next slide, please. So in conclusion, I think we need to respond to the challenges of post-COVID syndrome. We definitely need a lot more research, and it's great to hear Fergal is involved in 2 very significant research projects. We need to support recovery using specialised assessment and rehabilitation. And we also then need to build resilience to empower individuals to self-manage their health and well-being. We can all work together to guide individuals through their recovery journey, redirecting that downward direction initially experienced by a lot of people with long COVID, enabling them to redirect that curve to an upward curve to enable them to manage post-viral syndrome and then also to live a very fulfilling life. So thank you very much.
Diane, thank you very much. That was very informative. I'd like to move on then to Neil Wallace from the Labour Relations Agency, and to present your presentation, and we'll come back to questions then for everyone at the end, okay?
Sure, thanks very much, folks. Thanks for having me. So I'm Neil Wallace from the Labour Relations Agency, and I think I'm following 2 fantastic presentations there. Fergal, your presentation is very hard-hitting from a perspective that I think it's the first I've come across hearing a personal run through of what it's actually like to be at the coalface as a patient, and how that rolls out after you're turned well when you return home. And thanks for sharing that. It's really kind of hit a nerve. Over the last year or so, we've been dealing with a year and a half. We've been dealing with this, and it's somewhat cleansed in a way where you see figures and things, and you're busy doing a lot of work, and you're looking after your day-to-day activities, and to see the human side of that's very important. Thanks for sharing that. I've taken a good bit away from that, Fergal. And then following from Diane, I think it's really fantastic our health service again able to pivot and provide a dedicated service such as that to look after people with this condition, and a condition as clear as something that's just appeared over the horizon, and it's going to be with us for a while. What I want to talk about is in the work-based context of it, and that's whenever people return to work after long COVID. I want to look at the disability kind of aspect to that. Ideas in a phased return to work, possibly a template that people might want to look at as a way to move that forward. Look at options of when SSP ends. Long COVID, it's as individual as the person, and some people might return quickly. Some people might return over a period of time, and some people might be out for a long time. So SSP will come to an end at some stage, and you might fall into that bracket. Then I'll look at some questions about a return to work interview. What should employers and employees and employees reps be looking at in terms of those important interview questions whenever you're returning back to the workplace. And then look at options for employees whenever they're not able to maintain their optimum level whenever they return to the workplace when they're suffering from the condition. Next slide, please. So returning to work after an absence. So with any absence, not just long COVID, but any absence, employers should really have a defined policy to look at this. Absence management policy that's well defined. If there's a trade union involved that has trade union involvement and there's buy-in there, everybody knows it, staff are familiar with it, managers are familiar with it, and everybody knows how it works and operates. And it should dictate how absences are managed in terms of how you report it, how the person's brought back in, and how the employer will respond to a person suffering from an illness such as long COVID in the circumstances of the workplace. We have a guide to managing sickness on our website. I'll pop the link in on this slide. The link should be active whenever you get the slide pack, and that goes on to our website. The definition of disability is important here. This Discrimination Act is the person has a disability for the purposes of the Act if he or she has a physical or mental impairment which has a substantial and long-term adverse effect on the ability to carry out their normal day-to-day activities. So I popped in yellow here the parts of that are really specific to this individual circumstances that people are dealing with. This just covers everything in this field, but whenever you look at it in the context of long COVID, the element of substantial long-term adverse effect, and that having an impact on your day-to-day activities. And if you're listening to Fergal's piece there, that I think those three elements there were pretty much box ticked as you went through there. So really what you've got to ask yourself is, does long COVID fit into that area? And it's not for myself or the agency to kind of prescribe on that. But the best way to look at it is you have to take it into account whenever someone's suffering from this in terms of coming back into the workplace, because it does have wider ramifications than a normal sickness, as it were. The best information on this is not from the Labour Relations Agency, it's from the Equality Commission. So I'll pop their link in there. And they do have a document on the definition of disability, which can be viewed on their website. So I'll put those two in there. And you kind of always give us a shout. But the people who are experts in the disability arena and advised on that are the Equality Commission. So that's their information's there for you. Next slide, please. So the question I want people to ask themselves, and that's anybody involved in this, employers, employees, reps, or whatever, is does long COVID fit into the definition of disability? And that's the question that people need to ask themselves whenever they return to the workplace. It's not a cold, it's not a flu, it's something that's hanging there. It's having an impact on some level, and does it fit into that definition as per the Act? And if it does, that has very specific recommendations or ramifications that fall from that for an employer and for the employee, that fall out of that need to be taken into account whenever the person returns to the workplace. Next slide, please. So using that as a benchmark, ideas for a phased return, and these kind of fall into the health and safety aspects as well, which are pertinent to everybody here in this group. And some of the boxes here, if we look at the bottom one, the individual detailed plan, whenever someone's coming back into the workplace, they should ideally be looking at how do their hours build up. If they've been out for a long time, is it a phased return? What duties will the person take on board? Is it the full aspect of what they were on before, or is it a phasing back in? Are adjustments needed? And adjustments has a particular interest there, because Are there adjustments under the Disability Discrimination Act that need to be taken into account if we've met the definition of disability? Are the appropriate assessments of that individual taken into account? And what happens with pay? Everybody wants to know about that. What if I'm back full time? If I'm back part of the time, what happens there? Inadequate performance, just above that. What happens when the performance isn't adequate? Now, this is usually not because of the individuals not performing. It's because they're unable to perform because there's a detriment there. What happens? How do you review that? What way do you need to think about that? These are things that need to be thought about and agreed whenever the person's coming back to work. And that's, between the individual, if they have a union rep, and the management, getting down and really scoping it out. What impact will it have on other staff? And that's also a health and safety concern as well, because the other staff involved in that team, that unit, the group, will it increase their workload? What impact would that have on the rest of the team? Would it put an increased burden on the team? And so it's a holistic approach needs to be taken here, that there is the individual coming back to work, but there's also those who work around them, and it needs to be in your mind whenever you're coming back into the workplace that you're looking after the individual, but you're also looking after the team that they're going back into, and that they know what within the bounds of confidentiality, that they know what the person's coming back to do and what duties they'll fulfill. Pay arrangements, as I said before. So you're on reduced hours if you're coming back in a phased return. Maybe you're not, and you come back to the workplace full time, and then you might find that the person's incapable of working the full-time schedule and they need to scale it back a bit. What about reduced pay? How does that work? Need to have a think about that. SSP and enhanced sick pay. Some people might have an enhanced sick pay regime. How does that work in the context and their annual leave and things like that? And it's important to discuss the issues of each individual circumstance. They're going to be unique. The person's unique. What they're suffering from is unique. I might have bags of energy and be suffering in other areas. Other people may find their batteries drained very quickly, and there needs to be an adjustment there for the workload. So it's really the individual conversation that takes place, and you should really have really clear, open conversations with management to understand exactly what is in and what is out of a person coming back to work, and it's in the supportive aspect of that. Because the person wants to go back to work, they then want to come back active, but there's very little point bringing somebody back in who isn't capable of it because of the physical toll that the long COVID is having an impact on them. And it's really open and honest conversation there needs to be held between employers and employees, because without that communication, they might have been very clear with each other where the thing sits. You're going to get into trouble because people are going to expect more than really what's on the table. Next slide, please. So taking that a bit of a step further, what would a template be like? Now, I understand with the group we're here today, we have a very clear outlook, and most of the places we'll work in will have a very defined phased return, but this is just a kind of a ribbon approach of what it looks like. Occupational health review, using the occupational health side of things to advise both the employee and the employer of where things sit from a medical perspective. The fit to return, what are the time scales? Are there DDA implications, Disability Discrimination Act? Do you need to make adjustments, and what are those adjustments? And are there other questions that maybe you need to ask and answer that a medical professional from an occupational health perspective could put a spin on that? And I can't tell you how important that is from an individual's perspective. I've been through an occupational health review in the past, and I found it very helpful to be able to discuss with an independent person exactly where I felt I needed support, and to have that filtered through to the workplace. It's important that that's given the space that it needs to direct and inform everybody going forward. Then you're preparing for the return. Put a plan in place. Have a timetable of return. Share that with the team. get the adjustments in place if they need to be in place. Have a team meeting, and as I said, within the bounds of confidentiality, put it together to the team that the person's coming back. It's not a person coming back full time. There will be changes in place and what they are, and make that very clear so that everybody knows where everybody sits. Then the person returns to work. Regular interviews, keeping on top of how they're doing, making sure that the employer's looking after the welfare of the person. They're back in work, but that doesn't mean that they're not left and cut loose and forgotten about, that there's a close eye kept on them. The regular review of that, the reintroduction of the person is really important, because it might span a month or two to get them back up to speed, and making sure that the adjustments that are in place are helping them, and that the person's able to add to the business and add to the team and support everybody around them as well. And then back to normal is the final step on that. And that's a resumption to full duties, back to full-time hours. That may be after a period of time where it's stepped up, but that doesn't mean that the individual's going to be perfect for the next year or so. So because of this, we would advise that regular reviews are needed, especially when you're dealing with something as a bit ethereal. As more information comes out around long COVID, there'll be more information available how people react to it. But at the minute, because we're dealing with something that's a bit out there, and it's very, very individual specific, it's important that regular reviews take place to make sure that the person's being supported going forward. And adjustments can change over time, and it's important that within the potential disability discrimination aspect, that there's a close monitoring on those adjustments, and that the person knows that they can have a chat with the employer to make sure they're appropriately supported. Next slide. So options on SSPNs. Sick leave, there may be an enhanced sick leave policy in place. Some places do, some places don't, and that really depends on the individual circumstances and where the person's working. Annual leave, this is a bit of a difficult one to talk about. The person's sick, so is annual leave appropriate? In my experience, I've seen it used in the past, but the agency would be very wary about people involving themselves and people taking annual leave whenever they're sick. But when you put it into the middle of the context of people being off, they're having no pay, and people start to look for creative ways around things. But you just need to be extremely wary around annual leave. Annual leave is not sick leave, and you need to think about that quite seriously. Unpaid leave is kind of the natural run from whenever SSP ends. Unpaid leave usually will kick in some nature, but the policy in the employer will dictate how that runs through. Special leave, there may be an element of special leave provision within the employer, and that varies depending on the policy, depending on the employer. Some people will and some people won't, but explore a special leave, something you could look at to support the person. The last one, number 5, and I've started there because it's currently an option. It ended in October. I've left it there because we don't know what's going to happen over the next 6 months, even depending on how the winter goes. Furlough was something that you could have looked at in terms of popping the person on the furlough to maintain them over the last kind of year whenever it was active. It's not active now, but it's something, if it comes back, it's something that you could look at from a perspective of putting someone on the furlough to let them use that system as a mechanism of supporting them to get back into the workplace. Next slide, please. So briefly, questions at the return to work interview. A return to work interview is really important. It can be a bit of a pain for the employee and the manager, because if you're off for a day, you have to come back for a return to work interview, but they're really important. Welcoming the employee back, checking if they're well enough, discussing their details about the return to work, talking about the fitness to work from the GP, occupational health getting involved, updating employees on news when they were off or personnel changes, and looking at the Disability Discrimination Act and using the occupational health to guide you so that you're fully informed as to where you sit as an individual, but where the management side may look at that in terms of their obligations for reasonable adjustments under the Disability Discrimination Act. They're all things you need to look at whenever you're talking to someone about coming back to the work, or you're supporting someone when they're coming back to the workplace. Next slide, please. Work-related sickness is an element here. Is it something that is a work-related sickness? Are there any health and safety issues that need to be addressed because of that person's illness? Does that kick into the wider aspect of PPE and social distancing? Is it sickness in terms? This wouldn't be really long COVID, but in terms of a return to work. But is it sickness caused by looking after somebody else? Is that an element to this, especially during COVID? Is there a shielding element to this, or are they looking after somebody? Or is there another nefarious reason, kind of they're being bullied by a manager or something like that in the background? But they're important things to bear in mind within a heightened atmosphere, especially whenever we have lockdowns and with people shielding and very vulnerable groups and living side by side with people who weren't as vulnerable, and that they kind of crossing over there, which would heighten that element. The next slide, please. So, if you're unable to perform your optimum duties, it requires consideration by the employer. You need to look at whether there's potential disability available, because there's a wide range and they're very individual. And as I said, many times it'll depend on the person and what they need to support them. Are there potential capability issues? And what way do you look at that in terms of long-term capability? And is there potential for dismissals to come along further down the line? And with that, it's a long way down the line, but bearing that in mind, having a look at the Labour Relations Agency Code of Practice for discipline and grievance, which I've popped the link in there for as well. It's just to bear that in mind, the wider context of it on a long-term position. Next slide, please. So the context for ourselves, the Workplace Information Service, I've popped in yellow there. That's the service that anybody can phone up, employers, employee reps, employees, trade union officials, anybody can give us a call, and we'll talk you through any of your workplace your workplace queries. Doesn't necessarily have to be around sickness or anything, but anything at all, you can give us a call on that number, or you can email us at info@lra.org.uk. At the minute, our offices are closed, but if you need to send us anything, you can pop us in there, the contact details. Thanks very much.
Thank you very much, Neil, for that very informative presentation. I'd just like to move on now to Janet Newsham from Manchester Hazards. You're very welcome, Janet, and thank you for today.
Thank you very much for inviting me to be part of this long COVID panel, and it's wonderful to be back and be invited back to your fabulous conference. And also, absolutely, we would echo the thanks to all those safety reps who have worked tirelessly throughout the pandemic and saved lives. Without you, more people would be dead, and more people would be infected and left with long COVID. And I follow three great speakers. And I'm just going to add one or two more bits of information to the picture. As Carmel said at the beginning, there was a report released last week from two UK parliamentary committees saying that the UK's response to the pandemic has been the worst public health failure ever. I take that in, the worst public health failure ever. And that was a mixed committee of from all different parties. And as Gabrielle Scally from the Independent Sage said in August, there has been no episode in history when a government has willfully willingly aided and abetted the spread of a dangerous infection disease in its population. We have, Carmel said, over 150,000 deaths. We'd say perhaps over 160,000 deaths, because we know not everybody has been counted and included in this, but it's a lot of people. Thousands of deaths that could have been prevented. We've got thousands of infections. We've got over 1 million people living with long COVID, including children. And it's not the end of the story. You know, since school started again, we've got a mass infection strategy across the UK. And the UK has been the worst in Europe and one of the worst in the world, in the developed world. They have failed to put public health measures in place to protect its citizens and failed to enforce workplace mitigation to protect workers. None of the UK governments have been exemplary in their responses. And I say all have death on their hands, and as a result of not controlling the transmission and infection risks, have been complicit in leaving those thousands and thousands of citizens, including children, with long COVID. Next slide, please. So our experience in the Hazards campaign, we're a campaigning organisation, occupational health and safety, and we also advise workers and trade unions on occupational health and safety issues. So our experience has been that employers have failed to control the risks in our workplaces, and the enforcement authorities have not enforced our health and safety laws. And that's left thousands of workers exposed, infected. And as I said before, some have sadly died, but thousands left with long COVID, long-term ill health and disabilities. And we know that not everybody was tested in the beginning, not everybody was diagnosed or treated, and not recorded that they had COVID, and yet have been left with this long-term ill health. And some employers, those with well-organised, some that have well-organised trade union activists in them, who have negotiated reasonable adjustments for those workers. And things like sickness and absence policies, making sure that that doesn't trigger any points on the absence policy, that they've removed COVID as a factor. Some workplaces have ensured that there's flexible working in place to support those workers. But it's, you know, for some workers, there was never any sick pay. So that some trade unions have made sure that that was in place to try and avoid hardship and infections. But this government's mass infection strategy in our schools is put, whilst not putting in place the mitigations of the risks, or that, you know, which is a risk to anybody that's vaccinated as well as the not vaccinated, means that the infection rates have gone up. And, you know, we're still in a very serious situation. And that doesn't, if you've been infected, doesn't mean to say you won't be infected again. And that's the problem that we've got into now, is that, you know, some of our people with long COVID are at risk of being infected again, and that could impact again on their health. Next slide, please. So we know that there's been a disproportionate impact, an impact from exposure to the COVID-19 for those that have had to work all the way through the pandemic, and those that, you know, and that includes, so those that have worked through, the ones that are disproportionately impacted because of impoverished living conditions, work conditions, our Black and ethnic minority colleagues, who not only were disproportionately impacted because they were going out to work, but also faced systemic racism. So weren't protected by PPE, where it wasn't available to them, weren't protected by the system that should have kept them safe. And those with existing conditions that's impacted by long COVID, as we've heard before, that additional impact that they have. And it doesn't stop there. As the infection rates rise and rage, then the dangers of the multiple infections, as I said before, there's issues around the cumulative effect, that's the word, cumulative damage on our bodies. So there's issues, and if we're vaccinated, we can still be infected and we can still be infectious. So that's important. Next slide, please. This picture was drawn by Paulina Sparks from the Long COVID Support Group, and there is some fantastic organisations out there that have developed through the pandemic to support workers and to support individuals in different industries and sectors, and to support children who've been left with long COVID. And, you know, by not being hospitalised doesn't mean to say you will end up with long COVID. You know, you can be hospitalised and have it, and not hospitalised, have mild symptoms, or the sorts of symptoms that Fergal talked about. And, you know, on top of that is the anxiety that it causes. So the anxiety that people are living through about becoming infected if they haven't already, or seeing family members or work colleagues infected, left with long COVID, or died. And so there's a psychological element to it as well. And many long COVID patients have struggled with disbelief and being told their symptoms are just anxiety and not real symptoms. And that's a major problem, I think, for lots of workers, that their employers don't believe them because they haven't got the record to say that they had it. Next slide, please. So what needs to be put in place and what else needs to happen? So in workplaces, mitigations need to remain and they need to be reassessed and strictly observed. We need to ensure that we are avoiding infections and reinfections at all ages. You know, the children in the schools, the teachers, school staff in schools. And whilst that transmission is so high, I absolutely, you know, when you're looking at risk assessments, does that job need to continue if there's a risk there? But secondly, can it be done in a different way? Can you be working from home? And certainly with long COVID people, then elements of the jobs could be worked from home. I mean, I know somebody personally who caught COVID just before Christmas, and she's a member of she was care staff and has worked from home ever since. They adjusted the job that she was doing to ensure she could do it from home, because she's not got the capacity to work in the job that she did previously. Making sure that your ventilation in all workplaces is good as it can be. And we've done lots of work. Hill Department that I work with has done lots of work with different trade unions to provide that information. And if you go onto the Hazards Magazine website, you'll be able to see some of that information that's really crucial in making our workplaces safe. You know, when everybody talks about hands, face and space, absolutely the most important thing we should be talking about at the moment is air, because COVID is in the air. And although we talk about distancing, in my mind, distancing is to avoid that very close contact with somebody, but it's also to avoid too many people in a space and having them for less time. So ventilation, absolutely crucial, and all the way down to keeping the cleaning hygiene is important for all infection controls. But the bottom line is that PPE must be at a proper standard, and it's not at the moment. We've been part of protests to try and ensure that the PPE is up to a proper standard. Face coverings are a minimal thing and shouldn't be part of our equipment. It should be PPE in all workplaces. So access to occupational health and health services is really important. There is still only about 14% of workers that have access to occupational health services. You know, without that, we haven't got that independent, that support in our workplaces. And so, you know, there's campaigns throughout the country trying to get an increase and improve that. We need our employers to be educated on what COVID is and the impact on our bodies, as we've heard before. There's still lots of employers who are disbelieving or dismissive of some of the conditions that people are experiencing. The reasonable adjustments, as we've heard, should be done on a passport, a reasonable adjustment passport. I don't know if you have one in your workplace, but looking at getting it written down and then reviewed, and then, you know, people who've supported. It's something that lots of unions have introduced, and that should include flexible working. It should include working from home, adjusting tasks to the individual, removing stressful situations which can impact again on long COVID. As I said, suspending sickness and absence reviews. And we should continue for isolation policies in our workplaces and sickness policies to be improved. We need COVID to be determined as a prescribed disease under the Industrial Injuries and Advice Council for all workers. I mean, there's a bit of a conversation going on at the moment that it would apply to health workers and care workers. But all those workers that have had to work through the pandemic have been disproportionately impacted and subjected to infection. So I think there's a lot more that we need to do. There's other countries have done it a lot better and have gone a lot further in the discussions. In the longer term, we need to redesign our buildings to support good ventilation and space. And, you know, there's also, we need to think about the carers. You know, if you're carers of people with long COVID, how is that impacting on your work now and your jobs? And we need to think about how we support all those workers who've got mental as well as physical impacts, and not least because of the bereavements that they have experienced and the anxiety that they will have been subjected to, the PTSD, etc. So there's lots of things that we can do to support people long COVID, to look at long COVID in our workplaces. As Rory O'Neill from the Hazards magazine said, the pandemic didn't cause our occupational health crisis, it exposed it. So this is something that went on far beyond COVID and the pandemic. And, you know, in the Hazards campaign, our motto, remember the dead and fight for the living, has never been more appropriate than at this time. So thank you.
Janet, thank you very, very much for that presentation and the information that was contained in it. I think it'll be vital for our reps on the ground. Just moving on then, what I would like to do now is invite questions for the panel. And if you can let me know which panelists you would wish to address the question to, or if it's for multiple panelists. We do have one question in at the minute. So the civil service is only one employer. EA libraries, health, housing, executive councils, etc. have different priorities. I think this is more addressed at the Labour Relations Agency.
Yeah, no, I see that coming through. I suppose each of those listed is an individual employer, and the policies and procedures that they will have in place will be, you know, determined by them and be unique to them. But across the board, they should have, or best practice is that they have a very robust set of policies and procedures that lay out how sickness, absence, and absence in general is dealt with. And this is just another aspect of that needs to be addressed in those policies and procedures. But I do take the point. The kind of thing I'm saying is that the best practice across the board, regardless of the employer, should it be Jimmy Joe down the country who has 4 fellas working for him, ideally, you know, they should have a policy and procedure in place that kind of governs that and puts a support framework around that. So you know, I take the point they're different employers, but I kind of the policy statement should be there for best practice.
Thank you, Neil. Any other questions? John, it'll just take a wee second for you to come into the room. Okay, so just give it a wee second. John?
Hello, folks. Can you hear me okay?
Yes, I can hear you. Great. That's great.
Rather than a question, this is more or less highlighting an issue regarding long COVID, and specifically the Western Trust's change of policy recently. I attended a management attendance meeting. Guy's been off with long COVID. Poor gentleman almost passed away. Wasn't a very, very lucky to survive. But the trust are actually moving now to put these long COVID members through the normal management attendance process. And at this meeting, they were actually looking to move to a final review for this actual member. Now, lucky enough, I won the argument on the day, and it's been delayed. But my concern is that these people with long COVID, certainly in the Western Trust, it looks as if they are starting to move to try to effectively, honestly, get rid of these people, which is absolutely disgusting. So, like I said, it's not a question, it's just a highlight that we have to be very careful and look out for this and give protection to our members at this very vulnerable time. Thank you.
Yeah, John, I take that point, and it could be, that many employers will actually move away from the fact of where they have given special consideration for COVID up till now or to a point, and that then they will adopt a different, under the standard management attendance policy. And that is something that we need to be very mindful of. And I think that, we need to educate too, the employers need to be educated in the impact of long COVID for our members out there. Has anybody else any questions for any of the panelists? Francis, just give it a wee second, you come in. There you go. You're on mute.
That's because I didn't want you to hear my dog talking. A question I would have that has just sort of been realised, the HR department within DFC, again, following on from one of the comments there, have changed the policy from the 9th of August, and staff were not informed that if you are off with COVID-related illness, that managing attendance procedures kicks in from day one of your absence from work. Up until that point, anybody who had been off with COVID was allowed 10 days special leave, and then the attendance procedures kicked in after that. I've had a number of members recently who have been hit and warnings instigated because of that. Is that across all departments or just within DFC? I would just like to know from the attendees or even from yourself and the panelist what the situation is.
So what basically you're saying is, Francis, this isn't directly just at long COVID, this is any absence relating to COVID related illness?
Yeah, but what I'm also saying, Margaret, is people who have been off with COVID have already been given the 10 days, and then they come back to work. They've then since been hit with COVID again, or maybe it's another member of staff for the first time, and the attendance procedures are kicking in.
So prior to the 9th of August, there was dispensation, and after the 9th of August, the dispensation was removed.
Which to me is an inequality issue as well. But I just want to know from a labour relations agency point of view, or from a HR policy, what way we can take this forward as reps to help our members who are suffering from both long COVID and COVID for the first time.
Okay, I'll attempt that from the LRA perspective. Obviously, there was something negotiated between TU side and management side over the reporting of the COVID regulations. Not knowing the specifics of the agreement that was reached. If it's the case that something's been rescinded, there's probably re-engagement needed there from TU side with management, just to get an update on that and see what the actual position is. But really, it'll relate back to what was agreed. What was put in place to take us up to the August date, and when was that? Was it an agreed change, or has it been a unilateral change, or does it need to be discussed? I think the best advice I can give is to get somebody from management in front of a trade union official and have a chat about it and see what the actual story is. There's no particular, there'll be nothing, legally wise that would have an impact here. It would be the policy is the policy, and if there's an adjustment to the policy that was agreed by both sides, that's fine. It's just the mechanics of when that is there. Was there a time of putting that, or what is the specific thing governing that particular dispensation for the COVID related illnesses? So it's just a bit of a chat is probably the first place to take that to first.
So it'll boil down to just taking each case as it comes in.
Well, I suppose if it's a policy change for everybody, I know, Francis, you were asked about, is that across the board? If it's something that's going to affect, anybody within any of the departments, civil service wide, then it's probably best to find out what the actual position is across the board. And then if there needs to be further engagement, take it from there. But it's not really an individual. It's probably not an individual case. If that's a blanket policy position, it'll affect anybody who's covered by that policy. So I think the first thing you need to do is find out what is the actual position today in relation to those illnesses and how they're reported, and then take it from there.
Thank you very much.
Could I ask Carmel to come in there? Have you any information regarding this shift by management? Carmel, can you hear me? No. My Jack caller just went to the toilet. Okay, Francis, what we'll do is if I can find out any information and on that, we'll bring it to you. Okay, we'll come back.
Thank you very much, Margaret, for the time. Thank you.
Okay, darling, thank you. Paul, were you looking to come in? I have a question here in the chat. So it's information control in the workplace when the public no longer are required to socially distance and staff have to deliver a service. How do health and safety reps balance working and infection control when the employers are pushing for services to resume normally? And I'd say probably, Janet, that's probably best place for you, is it?
Thank you. And just on the previous one, I'd be looking at disability discrimination as well. It could be that that there is an impact on that eventually. That they're being discriminatory in the way that they're changing it, and other illnesses that follow on from from COVID could be impacted on that. Could be impacted by that. But on this issue, we should be absolutely demanding risk assessments be reviewed. As a primary starting point. There's no reason why we shouldn't be insisting that all those mitigations are kept in place. That is infection control, and if our employers aren't doing it, then we have to force them to do that. That control hierarchy has never changed. And so we need to review the risk assessments in view of what's happening in our workplaces. But absolutely, from our point of view, infection rates are going up. Community transmission, if there's new variants that come along, then we're going to be more at risk. But even with the ones that are going around now, we are at risk of infection. So keep them to the risk assessments that you have as much as you can.
Yeah, I think it's also important too that, in specific circumstances, you may require individual risk assessments, because there's certain people who are immunosuppressant and would continue to maintain vulnerability to the virus, even with the return to work. And it's always making sure that the employer sees that the risk assessment isn't just I've carried it out, it's a living document, and it is subject to change if it's found that it's not actually functioning or creating the level of control that's required. Paul, you're on mute.
Sorry, Margaret, it had thrown me out. It took me a while to get back in. It's just the last question. It's just the last least question about the managing attendance and COVID. My understanding, and we had this verified last week, that normal COVID absences, so if I take COVID, that's not counted towards managing attendance. The 10 days special leave for people who had to isolate because they were in contact with someone who had tested positive. But with regard to long COVID, that is being seen as part of the managing attendance process as a normal illness. And my advice at this stage would be that if you have a member who's got long COVID and is off and they're using managing attendance, that go in under DDA to say there's a disability and ask for reasonable adjustments to the managing attendance process under the Disability Discrimination Act. But at this current moment in time, if I was to contract COVID, it would not be seen as a normal managing attendance process. Does that clear that up okay, do you think?
Yeah, I think that's, but I'm trying to see where Frances was coming from there, in the fact that what she's saying is that they are actually treating people who have just had COVID as the same way that they're treating people in respect to any illness.
Well, I'm also in DFC, Margaret, and it's not the case. I mean, but throughout the whole of DFC then, because I know that's not the case. You know, we're talking with Michael Cook at the minute because we don't agree that long COVID should be treated, you know, as part of managing.
Yeah.
That's what it is. However, we did get clarification of duties on. He could sort of tell you, because he's the one sent us the email to say that the normal COVID illness, if I was the contractor, would still have the same dispensation. It's not seen as part of the managing attendance process.
Right. Okay.
All right. That's let me in on that. I wasn't here to observe, but I'd seen that part and I went, God, you know, someone should say something. Thanks for that, Margaret.
Thank you. Any other questions? Okay, so what we're going to do now is I'd like to thank very much all the panelists. Virgil, for your very poignant personal experience of COVID, and for all the rest of the panelists in all your presentations, which will be shared with our reps, and I'm sure they'll find it very, very useful in the journey they have ahead and continuing to deal with the situation that exists due to COVID. We're going to break for lunch. So we are, if everybody's back then for 1:30. Remember, don't leave the seminar. Can you just turn off your cameras and turn off your mics, and then you can resume your session then after lunch. So if we can have everybody back then for 1:30. I'll see you all then. Thank you. Okay, welcome back, everybody. Hope you all enjoyed your lunch. I'd just like to welcome then Robert Kidd for this afternoon session and Alex Bunton as well for this afternoon session. Okay, I just wanted to address something that was raised just prior to us breaking for lunch, and it was around how staff being absent due to COVID was going to be addressed, and they had raised it as an issue for the NICS. So the way it's working at the present is long COVID itself will be managed under the managing attendance policy. Any other absences relating to COVID, so if you're required, if you contract COVID and you're off, or if you are required to self-isolate, then they are treated differently and they are not counted towards your managing attendance. But long COVID will be managed under the managing attendance policy. Okay, so I just wanted to clarify that. So I'm going to hand over now to Lorraine, who is going to chair this afternoon session as I'm a participant. Okay, Lorraine, I'm going to hand over to you.
Hello, how are you? Okay, I hope you've all decided to come back after lunch. I'm sure the second half of the program will be as interesting as the first one. So far, I've found everything really good and informative, and it's been lovely hearing everybody's views on everything. Okay, so I'm Lorraine Harton. I'm the Vice Chairperson of NIPSA Health and Safety Committee. And this second panel is on new ways of working. And the purpose of this panel session would be to address some of the key issues relating to new ways of working, and to provide our health and safety reps with the knowledge and tools to support the members going forward. Okay, so each panelist will speak for approximately 10 minutes, and then after that there will be an opportunity for a question and answer session. So if you want to put your questions into the chat box or in the question and answer function there, just as we have done before, and we'll address them then at as and when we can. If you're called on to speak, if you want to speak, raise your hand, and if you're called on to speak, it will take a few seconds, but don't log off or anything. It'll take a few seconds for you to be able to be called on. So our first panel, our panelists today for the second session are Carmel Gates, the NIPSA General Secretary, Robert Kidd, Chief Executive of HSENI. We've got, sorry, I don't know what I'm doing here. Okay, we've got Alex Bunton, who is from Inspire, and we've got Margaret Loughlin, who is the chairperson of NIPSA Health and Safety. So first of all, to introduce Carmel, Carmel has over 35 years experience as a rep in the civil service, dealing with fighting for her members and making sure that she has negotiated successfully a lot of times for the members, and it's rewards that we can all agree have been helpful for us all. She is now our new General Secretary, so congratulations, Carmel. It's good to see, and so I'll hand it over to Carmel now.
Thank you, Lorraine. Thank you for your kind words, and thanks to you again and all your colleagues for the opportunity to be here today. And this session is called New Ways of Working. Now, as it turns out, New Ways of Working is what the NICS are calling their changed and working environment and all that. I don't know if in other parts of the public services that kind of will be what is adopted as well. But we've also just recently in the NICS negotiated a policy which I suppose puts a stamp on new ways of working, and we've called it the hybrid working policy. Initially it started as our home working policy. It has since become the hybrid working policy because it is about more than home working. And it is about all the other areas where people work. So it covers home working, it covers remote working. So if you want to take your laptop to an internet cafe, it covers teleworking, which I know already exists in parts of the service where there are offices set up for people in departments to work from. Also in the NICS, we've been lucky enough to have hubs established in various regions. Now there's only a few of them that are operational at the moment, but the intention is soon that we're going to have hubs in all the key areas and in the travel to work corridors, so that the civil servants who have the furthest to go can stop off before their office at a hub. But it also very much also covers working in the office from time to time. And in negotiating that policy, the key issue for us was making sure that we protected people's preferences. There is no question that there are some people who have found the working from home, it doesn't, just doesn't suit them for whatever reason. For some, it's that their home doesn't lend itself properly to working from home in a comfortable environment. For some, there's too many people in the house. For some, they share a house with others. They don't own, they maybe rent. For others, they just don't like the isolation and they want to be with their colleagues again. Now, I don't know if we'll ever get back to the halcyon days of us all working together in offices and as teams and all the camaraderie and so on that we enjoyed there. But we want to make sure that people do have the option of of working in the office if that is their preference. So as part of this policy, we have ensured that those people who want to work in the office all of the time are protected in doing so. And not just that they can go into the office, but that they can have their own personal workspace within the office, because I think that is very important to all of us. You know, for some, it is an absolute struggle to go into the office and have to compete for a desk or not know where they're going to sit or not know if they're going to be sitting with colleagues. So for us, it was very important that those people who wanted to be in the office all the time had their own workspace that they could personalize. They knew that their desk was there for them when they went in the morning. But obviously there's others who don't want to work in the office. So we wanted to absolutely protect those people who have enjoyed the experience of working from home, want to continue to work from home. And many, for various reasons. For some, it is travel, the distance is too long. For some who have caring responsibilities, for example, they find it easier to be closer to those they're caring for, you know, for emergencies and other reasons. And it just makes life, it makes the balance, the work-life balance for them much easier. And then, of course, there's the blended working. And I think that's probably what most of us will end up doing. So we'll be in the office some of the time and we'll be working from home some of the time. So a key element of this is protecting our choices and ensuring that the employer allows us to make a choice. In the past, there was an excuse that, oh, I can't have somebody working from home because I don't know if they'll do any work. And it was the privilege of the senior grades who were allowed to work from home, nudge, when they needed to stay at home because their childcare had let them down. And they were trusted to do it, and others weren't. And now what we've realized that this notion of eyes-on supervision is no longer needed. And in fact, let's be honest, one of the outworkings of all of this is that people are always switched on. If your office is your living room, then you never escape it. And I know I and many of my colleagues I know are at their laptops far too long in the day and far too many hours, but also too many days in the week. You know, I mean, if your laptop's there on a Saturday morning, sometimes it's tempting to dip in just in case, because, you know, I think we've all reached a point where we can't stay on top of our emails, no matter how many hours we put in. But what this new environment therefore does is give us benefits, but it also gives us huge challenges. And I think the challenges are the things that I would want to talk about first, because I think there is absolutely challenges for in protecting our health, you know, and that comes to our physical health and our mental health. So even in our physical health, one of the things that as health and safety reps, you'll know, is that all of us need to be aware that of our working environment and ensure that we position our chairs properly and position our laptops properly and do all of those things, because they are crucial. And ensuring that we can work for the many hours that we do work, but also protecting our backs and protecting our necks and all of the things that are important. But as well as that, we need to be mindful of our mental health. And that is taking time to switch off and taking time to go for a walk and taking time away, because I don't know about anybody else, but I now wear these things for my computer work, which I never needed before the pandemic, because my life is permanently on Zoom and my life is permanently on computers, and all of that takes its toll on our physique. And I know obviously it has encouraged me to put on more weight, which is not a good thing either, because I was already overweight before the pandemic, and now things are becoming drastic. So these are things that we really do need to sort of take on board. The other challenges for trade unionists, and this is not unimportant and not insignificant, and particularly for health and safety reps, is if workers are not in the office, they're losing that solidarity, that camaraderie, the stuff that goes to the core of what trade unions are. And I have to say, we need to find new ways of organising our members, new ways of getting to our members, and new ways of ensuring that all the stuff that we do on a daily basis still gets done. And when people are isolated, often, they lose the immediacy of what a trade union can do for them, and the immediacy of contacting trade union reps even. I mean, when we're all in the office, everybody knows who the union person is. You see the posters up, you know, when meetings are happening and all of that. And when we were working from home, that doesn't happen. And I think there are huge challenges for us as trade unionists to address that in our offices, in our workplace, and in our union branches. But there are no doubt there are benefits. And I think one of the big benefits of all of this new ways of working is the opportunities that it gives to people to work in areas that they wouldn't previously have worked in. I mean, I know, for example, in the NICS, most of the jobs are in the hubs. They're in Belfast, they're in Derry, they're in the big towns. So if you live in the country and you are away from, you know, transport links, it can be very hard to get to those the big towns and cities. And as a result, a lot of people, and I have to say women in particular, have ceased going for promotion. So they stopped going for promotion because a promotion meant they had to move to somewhere else. I think under new ways of working, it is opening up opportunities for women, but also for other carers, people who are single parents and people who are caring for elderly relatives, that they can now take a job and that enables them to do the job but work from their home location. And I think that is something that is to be embraced and for us to enjoy. I've probably already spoken for far too long, but I do think that these are the crucial issues for trade unionists. But some of the other challenges I think that we have just now is some political interference from politicians who think that unless civil and public servants are back in the offices and spending money in cafes and restaurants and so on, that the economy is going to collapse. I would like to say to them, if they want the economy not to collapse and if they want the economy to be benefited, then they need to give us all a decent pay rise, because that is the way. I mean, public servants spend in the local shops and spend in the local economy, and they don't need to be in their offices to be spending money, but they can't spend money if they don't have it. So rather than the £100 voucher, I would like to see us all getting at least an extra £100 every month in our pay packets and reward for all the work that we have done. I think obviously also some of the other challenges for new people going into the workplace is, you know, particularly young people coming into workplace for the first time. I think we all have to be on the lookout for our younger colleagues who are coming into their first jobs and possibly been trying to be integrated into workplaces where most of their colleagues are working from home and where all their experienced colleagues are working from home. And that learning and that passing on and that bringing people into the workplace and understanding the social aspects of it, as well as the work, is something I think are going to be challenged for us. And I think that is a challenge for us as work colleagues, but it's challenges for us as trade unionists, because, you know, one of the reasons we are trade unionists is we want to build a better life. You know, we you know, as trade unionists, we are conscious of our social responsibilities as well as our workplace responsibilities. And I think these are the things that we need to be mindful of as we go forward, integrating new and young people into the offices, recruiting them into trade unions, showing them the value of joining a trade union and being part of that. And I think that if we can do that and we can continue to build and to grow, then I think we can embrace this new challenge of new ways of working. And hopefully we can roll out all the best practice that exists across all employment areas, both public and private, so that all workers enjoy the flexibility that technology and this new environment provides for us. So thank you, Lorraine. I hope I haven't spoken for too long. I think I probably have as I glance at the clock. But hopefully it was that was okay. Thank you.
Thanks, Carmel. We do have a few questions coming on, but I'm going to keep the questions till the end after all the panelists have spoken. So if you do have a question as well, could you maybe say who you want the question directed to? Otherwise, we'll just maybe open it up to the panel. Okay. So our second panelist is Robert Kidd. Robert is the Chief Executive of HSENI. Robert, you're very welcome. Robert joined the Northern Ireland Civil Service in 1988, and it says after the dinosaurs, but before everyone had their own computer. I would argue that there might still be a few dinosaurs about, but so you worked for the Police Authority in administrative roles, and then for NISRA as a statistician, then the Department of Social Development, now the Department for Communities, on urban regeneration projects. In late 2011, you moved to the Department of Justice as the head of organised crime, firearms and explosives branch. I actually think I was speaking to you whenever I was in Department of Justice. This was a regulatory role involving facilitating the organised crime task force, legislation, inspection and licensing for commercial explosives and pyrotechnics. And his branch also dealt with firearms licensing appeals, and much of your work in DOJ was underpinned by health and safety legislation, and you were appointed to the Health and Safety NI as the new Chief Executive in January 2019. So welcome, Robert. Over to you.
Lorraine, thank you very much for your welcome. And thank you as well to Geraldine for the invitation to join with you all today. It's hard to believe that the last time actually I was at your conference, I was actually there physically in the Wellington Park. And who'd have thought that if somebody had told us we were going to experience a world pandemic and spend almost 2 years working from home, it's kind of been a surreal experience. Really interesting too. Good to see Carmel, and great to hear some of Carmel's comments. It's funny because just about everything Carmel said, I think probably resonates and is covered in my presentation. So it's really interesting, and I suspect we're all going to be coming from a very similar angle. Forgive me if I'm not constantly looking at the camera, because I have some notes in front of me and I've got my own slides in front of me as well. So I'm kind of bouncing around here between the computer that I'm using for Zoom and a couple of other sources. Just to introduce today, one of the things I was going to say was to start with a quotation. And the quotation that I thought was quite appropriate for today was, "May you live in interesting times." And I'd gone on to Google just to see who actually was accredited with saying, "May you live in interesting times." And actually what I found was that it's not actually a blessing, but it's actually attributed as coming from an ancient Chinese curse. So it's maybe more or less appropriate to actually use that, given what we have been through with coronavirus and the challenges that has presented to us. I think Carmel set the scene perfectly. The changes that we've seen over the last almost 2 years, probably coming on to 20 months now, are unprecedented. Carmel said there she's been involved in IPSA for 35 years. I've been in the NICS for 33, so we're very much similar vintage. And I don't ever remember a time looking back at the NICS where there have been such significant changes. Basically overnight, we all moved to working from home. For some, it might have been less difficult and less traumatic. Some staff may have been mobile enabled with laptops or tablet devices. Other staff over a number of years may never have worked a day from home and found it a really big challenge. Carmel also highlighted some of the real issues. Many of us may have a little space or a space set aside where we have as a kind of home office. But suddenly for many of us, we were in a situation, and I know certainly for me at home here, I found myself in a situation where I was working from home, my wife was working from home, and my son, who's at university, was also trying to study remotely. So suddenly we actually needed 3 office spaces in the house. So that presented some real challenges. And again, Carmel just mentioned a lot of the issues around getting appropriate space for your desk so that you can set up and have an appropriate setup. So some very, very significant challenges there. And the other point that you mentioned, which I just jotted down, was about being always connected. And I think this is something which so many people can relate to. And I got very annoyed whenever I listened to some people on the radio saying about civil servants, and these folks are sitting at home all day watching daytime TV. And I know I've certainly yet to encounter anybody who has spent their days watching daytime TV. It's bad enough having to watch it if you are actually off on leave for the day. But I think for many of us, we've suddenly experienced an issue where you are always connected. You're always contactable because your laptop's there, your computer's there. Many more staff, I suspect, have mobile phones who might not otherwise have had mobiles. So that, I think, really sets the scene. Just to move in, if I can move to the next slide, and hopefully you can all see the slides okay. So what I've set out here is just a couple of reference materials which people might find really useful. And I'll make no apologies up front that the first one that I'm quoting is actually a guide which has been put together by Don Leeson's team in the Labour Relations Agency. This is an absolutely excellent resource. It's only just been published this month, and it's called A Practical Guide to Hybrid Working, and it's on the LRA website, so you can download that. It's a really good document actually to work with on your desktop because there's lots of live links which take you to other documents and other help guides as well. So it's one that I would definitely recommend. There's also some information on our own website at hseni.gov.uk. And if you go to the tab marked topics, there's an A to Z of a whole raft of issues, and you'll find some guidance there. There's also some stuff on nibusinessinfo.co.uk. And I've just mentioned there at the very bottom, the links within the LRA document. Again, there's a whole raft of material there, which is excellent. So if I can move on then to my next slide. And I've tried to set out just in a couple of bullet points there, some of the challenges which we face. There's around, I think I'm right in saying at the moment, we're sitting at around 23,500 civil servants, plus many other public sector employees. Working from home, as I've said, is new to a large majority of people. Looking at my own team within Health and Safety Executive, I would have a number of staff who obviously as inspectors would be heading out directly to site on a number of days a week, so would not have been in the office each and every day. So for them, this was less of a turmoil. But for many of the support staff, our premises team, our call handling team, they were all office-based. And indeed, in my 33 years in the NICS, I only remember very occasionally working from home if I had something that I really needed to focus on. And I would have done it from time to time, certainly in my time in NISRA, if I was checking statistical reports or figures before they went out, and I needed just the space to concentrate and not be disturbed. But for many of us, I'm sure it's been a very rare occurrence. The duty of care which exists, and I'm sure this has probably already been discussed, but as many of you or all of you I'm sure will know, the employer has a duty of care, and that duty of care kicks in regardless of where the employee is based. It doesn't matter whether they're working in the office, whether they're working at home, or whether they're working somewhere else. The employer still has that duty of care for their employee. And the other thing that I've added on to that is there's also an individual responsibility. As individuals, as employees, we have a duty of care, not only to ourselves and to look after ourselves, but also to ensure that nothing we do in any way affects or potentially endangers our work colleagues or others that we might interact with. So those are just some basic premises. To move on then to the next slide, please. So challenges and opportunities of home working. The move from traditional office working, we've kind of gone from the vast majority of people working at home to, as I mentioned, overnight. It was basically an enforced regime where staff were contacted and told, don't come into the office on Monday. We're going into a lockdown situation. So we then went into this, what I've called a forced home working policy. And now we're looking at this new way of working, which will involve some choices. And again, Carmel touched on them. And there's lots of challenges there. And it was really interesting to hear what Carmel has said, because I've seen some of the results of surveys across my own department and indeed across HSENI as an organisation. And I think it's really interesting because something which I've certainly experienced from speaking to my own staff, we have a small number of staff who have said they've really hated having to work from home. They miss the camaraderie, they miss the contact, maybe people who live at home on their own. But for some people, it's just they like to have that separation as well between their home life and their work life. And suddenly having to have work life operate from home becomes a real challenge, and they see it as almost a bit of an infringement on their personal life. So I think that's a very significant issue, and many people do like to keep that segregation. The hybrid working, I think a lot of people will see a balance. And again, Carmel referred to it, working partially at home, partially in the office. And obviously as these hubs come online as well, it may facilitate a real saving for people who maybe have to commute quite a distance to get to their normal office. And if people can go into hubs and connect to the network or use printers, scanners, etc., that'll be a real bonus to them. The hybrid working is really just what I've mentioned there. So access to home, to the hubs, all of those things will help improve the work-life balance. I think the other thing we've seen very significantly is an increase in productivity. And I think we've been through probably a bit of a roller coaster, because I think the early challenges, people worked extremely long hours. And I think we all had to cope with extreme pressures. There were lots of unknown questions. There were lots of challenges being thrown at us. And I know for trade union health and safety reps, this was no different, because people were asking questions, which in the early days, certainly none of us had the answers to. But there was a lot of increased productivity because people worked extremely long hours, and they worked really hard to try and clear the mailboxes and for the good of not just the organizations, but for their colleagues as well. And I think staff were very motivated and very driven. But I think then as time went on, people realized that this wasn't sustainable long term. And we started to have a dip, not a dip in performance, but people realized that actually this wasn't sustainable. I often, when I'm speaking, would talk about my own situation. When I was in the office, our building had a contract for the opening and closing of the building. So the security team would have arrived usually around 6:15 or 6:30 to close the building. And they would have walked around, checked all the windows, made sure everything was secure. And if you were around the building, they would have wrapped your door and said, we're closing in 5 or 10 minutes. So at that point, obviously, you were faced with the option of either packing up and going home or making yourself comfortable to spend the night on the office floor. But I think since we've all got used to home working, it's much more difficult to actually make that break. And I'm sure for many of you here, you've experienced a situation where you've maybe stopped, gone and had your dinner, and then find yourself back at a computer. Carmel said about weekend working as well. It's all too easy when the laptop's there. And I'm sure many of you have a situation where the laptop's connected and it's just too easy to go in and log in and check the emails or try and get yourself caught up, because nobody wants to come in on a Monday morning and have to start dealing with the backlog of last week's emails. Again, I almost wondered, I was smiling as Carmel was speaking, because she's covered a lot of the points that I have on my slides here. The difficulty for new staff to integrate into the organization. Again, this is something I'm sure all of you have experienced with new colleagues coming on board. It's extremely difficult to make someone feel part of an organization if they never actually get to meet all of their colleagues except over Zoom. They don't get to experience just the simple things, walking down the corridor to tea point to make coffee, going and sitting in the kitchen or the canteen to have lunch and get to meet staff. All of those things are really important in building those social networks and getting to know your colleagues and your co-workers. And I think some staff, certainly, and again, I alluded to it, some staff are feeling isolated. Some staff do feel very cut off. And I've tried to make an effort. I've about 115 staff within HSENI, and there would obviously be a number of staff that I'll deal with on a very regular basis. But from time to time, if I have the opportunity, I will lift the phone and have a chat with folks that I wouldn't normally get a chance to speak to. And it's always interesting just to hear how people are getting on, how they're coping. Some people, as I say, by necessity of their work, are in the office a little bit more. And other people don't get into the office very much. but are really struggling and really miss not being in the office. And despite all of the things that have been tried, and I'm sure many of you have tried as well, we've had Zoom coffee times that have been set up occasionally, and we've encouraged people just if they can take half an hour to go on to a Zoom meeting and just have a little bit of social time. So it's completely work-free time where the Zoom is set up and people can come in and just have a catch up with people and have a chat, see how people are doing, talk about all of the kind of non-work stuff that you might catch up on, whether it's children or pets or holidays. And what are holidays again? So there's lots of opportunities, but I think there is a real craving for many people to actually get back in to the office in some shape or form, and whether or not that's a long-term aspiration to see full reoccupation of buildings. But I think even when we get to hopefully after Christmas and start to see partial reoccupation of buildings and to let people feel part of their organisation again. So if I can just move on to the next slide, you'll be pleased to know I've actually only got another 2 slides after this one. So I promise I'm not going to do death by PowerPoint. Working from home, again, there's lots of challenges in working from home. And I've already had staff speaking to me about some of the issues. If I'm working from home, will I either be forced to choose the days that I work from home, or can I choose the days that I work from home, or do I need to be flexible? And I think that's a really interesting question. It's not a health and safety issue per se, but it's an interesting question. And I think I've just said there, I think it will vary from role to role. I think one of the challenges for many of us as managers is that if people specify and almost get into a contractual arrangement of what days they come to the office, there's a risk that some colleagues will never actually see each other. You almost become like a job share arrangement where people don't actually overlap in the office. So I know certainly for our own team, we're trying to encourage a degree of flexibility. We will be trying to facilitate people where we can in the days that they would prefer to be at home. But we've asked people to try and be flexible where they need to, or if they're requested to by line management, just to help if we need to have meetings. And of course now we will have increased flexibility as well, because some people will be able to log in and join meetings over forums like Zoom. Maybe subject to periodic review. Again, this is something we're looking at a number of different cohorts of staff. We have identified within our own organisation, we have 2 fairly large cohorts of new staff who will be joining us. And one of the key things we'd like is to bring those 2 cohorts together as 2 groups so that they can actually get to know each other as one, because they're new staff coming into the organisation, and actually most of them, or many of them, may be new to the civil service. So we'd like them to learn together and to get to know each other. So they'll take up a degree of space within the building. And obviously, again, at the moment, that's predicated upon social distancing and all of the other precautions. So we'll review those things periodically. We're also looking at how staff will actually use the building. So we've allocated particular rooms to teams, and we've said that teams can book those rooms, and there's a system I know which many of you may already have access to. It's being rolled out, which will allow you to book the rooms basically using an Outlook type system. And we'll be using that and then monitoring the room utilization to see what groups need more space than others. Communication, I've said here, communication, feedback, and engagement is important. I think important is probably an understatement. I think communication is absolutely vital. I think managers, staff, trade union reps, I think there needs to be a really ongoing dialogue about how things are working. People need to communicate. The situations are going to be different for each of you because your buildings are all different. So how staff can actually access buildings will be a challenge. Some of the buildings, obviously, if they're more high-rise and staff are more reliant on lifts and things to access their floors, that becomes more challenging. Certainly within my building, HSE in Lattice Drive, it's an old building. Much of our space is in offices, and those offices typically at the moment would house 2 people. but under social distancing, they're only suitable for one. So that obviously presents a challenge that we're down to probably automatically around 50% of our capacity. And with other social distancing arrangements, we're actually going to start on a lower figure than that even, and just build it up as people feel that it's safe. Again, working closely with TU reps and with staff just to see how people feel about the arrangements and observe them. Sorry, moving on then to the next slide. The employer's responsibility. Again, you'll see some stuff on our website about the employer's responsibility. And I've highlighted again the employee's responsibility. This just comes back to the duty of care that people have to look after themselves. Risk assessments, we've all worked at home now for over a year and a half. There's been very many challenges, and I'm sure for many of you, I'm looking around my own setup, and whilst I've got a good setup of a desk and I've got my office chair home with me, so posture and everything's good, one of the big challenges I think for many of us is the number of sockets you may require. So I'm running a trailing extension lead that I'm having to plug in a number of different sockets for laptops, for chargers, for external monitors, and all of those things present challenges. And we need to ensure that we keep ourselves safe. So there's lots of challenges. And I know I've mentioned there portable appliance testing. That is something which I suspect is likely to continue, and staff may be asked to bring those work appliances and devices that they use back once a year, so that those tests can be done on their leads and the appliances and things to make sure that everything is safe. The challenge, again, I mentioned earlier, of multiple people working from home. It doesn't matter whether you live on your own in a small flat or apartment, or whether you're in a family home. If you have one person in a limited space, or if you have a bigger space but multiple people all looking for office space, it presents very similar challenges. None of us want to have 2 or 3 office desk setups around our home. Again, it's a bit of an infringement. So it's about getting suitable space where people can work and work comfortably and work safely. And again, there's a lot of guidance out there on how you can do that, how you can check things. And I'm sure for many of you, you have been encouraged by your employer, whatever department you're working with, to bring your office chairs home. I know this was something certainly which we did within HSENI, and our parent department, the Department for Economy, had encouraged staff as well to call in and bring their chairs home so that they had suitable seating. Because posture, as we know, is a very significant issue when we're working at a computer for many hours a day. Mental well-being, again, massive issue, and something which is quite rightly getting a much more significant profile. And I think it's become a real challenge, and obviously coming through lockdown, the challenges of home working, homeschooling, looking after maybe elderly, vulnerable relatives. There's been lots of challenges, and all of those things impact on each of our mental well-being. And the loss of the social aspect, even of the workplace in itself, is a challenge. The work-life balance, and I've mentioned there the right to disconnect. And this is something I think which is quite important on all of us as line managers, to ensure that staff do get the right downtime, to ensure that staff do switch off and spend time, whether it's spending time with family, spending time doing leisure activities or things that they prefer to do, but they need to have that time when they can completely disconnect, switch the computer off, not have to worry about phone calls, etc. And that's very important. And I've just stuck on the end there, WTR, so the work time regulations. Again, I think many of us would probably admit to having worked many more hours than we should have, and all of that's important. So just then on to my next slide, if I can. So to consider then how we can better manage staff remotely, I think this is, again, a really interesting challenge. I've had a couple of conversations with people, just actually interestingly over the last couple of months, and coming from both sides, speaking to people who were managing staff and speaking to people who were being managed, and just listening to the different perceptions of how those interactions were happening. And one person initially said to me, I feel like I'm being micromanaged. And when I had the conversation with them, I said, why do you feel you're being micromanaged? And they chatted and they gave a couple of examples. And I said, well, you need to appreciate that your manager actually doesn't see you, hasn't seen you for months. They're not necessarily doubting that you're getting the work done. And I said, but put yourself in their perspective, because they're trying to reach targets. And one of the things I suggested to them was, why don't you drop an email to your manager, even once a week, an email with a couple of lines, and just say, dear so-and-so, this week I managed to get X, Y, and Z completed. And you'll remember that I was working on such and such a report. Well, it's about 80% done. And I said, actually, that will reassure your manager. And I think for managers as well, we have to look and we have to adapt at how we manage staff, because we don't have that ability just to call into someone's office when you're making yourself a cup of coffee and have a chat about how's this going, or how's project X going. Did we ever get a response from so-and-so about this piece of work? So it's about trying to adapt. And I think there needs to be a little bit of change and a little bit of rebalancing, if you like, on both sides. Consider opportunities to build and improve team cohesion. Again, I think it's looking for opportunities. I mentioned earlier that we had tried setting up some coffee meetings over Zoom. And the rules of it was that anyone could log on. You could come and go as you needed to. So if your phone rang or something and you needed to drop out, that was perfectly acceptable. But the only real rule was you weren't allowed to talk about work. Once you were on and you saw someone, you couldn't say, oh, by the way, I was to get such and such to you. You weren't allowed to mention that. It was purely a social aspect. And that half hour to 45 minutes just allowed people to come in, have a chat and a catch up. One of the things I started to find over time was people said, do you know what? I'm completely zoomed out here. I am fed up with Zoom. I do so much Zoom with work. The last thing I really want to do is use it for social purposes. So I think, again, it's incumbent on us as both managers and employees to look at other ways that people can actually come together. And I think now that we're starting to see easing of restrictions, one of the things I have encouraged my teams to do is to actually meet up and go somewhere for a coffee. Go and actually meet up as a group, whether it's to go for lunch, go for a coffee, and just actually, again, spend a bit of time. Yes, you can schedule a bit of time and say, right, we're going to have a bit of a team meeting and keep a little bit of it informal if you've got an appropriate setting where you can talk work, but also to actually set aside some time actually for the informal chat and just to actually get to know. And it's really important as well where there's new people have joined the team so that they can come together and again, just get to know their work colleagues. Ensure a feedback mechanism. And again, I think this is something which is really important. It comes back to the point I made earlier, just about communication. Just ensuring that people can actually feed back on how things are working. And that's just an opportunity without any criticism or condemnation that somebody can say, this is or isn't working for me, or this would really be good if we could do X. Is it a possibility that can be considered? And just again, kind of touching on another point, social interaction, online and face-to-face. Again, it's kind of like the team building opportunities, just how we can get people together. So I'm conscious of time. I've probably gone over my 10 minutes, but I'll finish there. My next slide is really just to say thank you all for listening. And it's great to see so many people online, albeit virtually again.
Robert, thank you very much. That was actually really interesting and very informative. Personally, I hate working from home as well. So it's just not it's not for the social animal that some of us are. Okay, so our next panelist is Alex Bunting, and sorry, just going to get my notes up here. See, this is what happens when you rely on technology. Everything falls around you. Alex, it's lovely to welcome you here today. Alex is the current Group Director of Inspire Mental Health and Addiction Services. Alex has managed mental health and addiction support services for over 17 years across Northern Ireland, working primarily in communities impacted by trauma, conflict, and significant health inequalities. Alex has worked extensively in developing approaches to support the recovery of people, in particular those impacted by poor mental health and addiction. Alex is a strong advocate for person-centered care and challenges some approaches which look to label, stigmatize, and create barriers for people to access the support and treatment they need. Thank you, Alex. We'll look forward to hearing what you've got to say.
Thanks, Lorraine. I don't think my bio was half as interesting as Robert's. So, Robert, I think of a good name for your book, Statistics and Kalashnikovs. I think you should go with. Amazing career to hear what you've done and where you've worked. Again, just thank you today for the invite to come and speak with you around a very important area for us all as we move forward. Fully agree with everything that everyone has said today in terms of the unprecedented times that we're all in. It has been both humbling and inspiring to listen to some of the commitment of your members and your staff, listen to Fergal's story and how long COVID has impacted him and some of the other issues that's been flagged and brought up today. I think the sacrifice that you and your members have put in for everyone in terms of the wider public over the past 20 months has been immense. So I'd just like to thank you all for that. I suppose I would just also like to say that it's never a bigger role in terms of health and safety in protecting and supporting your colleagues and members. We have a lot to consider in relation to how we aim to support people and work in relation to their physical and mental health as we move forward. That's also to highlight the huge part that trade unions are going to have to play moving forward in representing the needs and those ongoing needs, as well as working in partnership with many of those workplaces to ensure that staff well-being is prioritised. I think also that there's a lot of preparation that needs to happen in terms of the medium to long-term impact of the pandemic, as we've heard already today about the impact of long COVID. And I'm going to touch a little bit on the emerging needs in terms of mental health and also addictions. We see a lot of people now being referred through our addiction services who have developed issues during the pandemic in relation to home drinking in particular. Employers do have a significant responsibility to ensure that they adjust to the impact of the pandemic and also the ongoing and development needs of their staff. We continue to see as an organisation increased challenges with burnout, compassion fatigue, and work-related stress right across our mental health and addiction services and our employee assistance programmes. And that will pose a significant challenge for us all to provide services that can address the impact that we've felt from the pandemic. Next slide, please. Okay, I just put this quote up, and I suppose it does highlight how we viewed the workplace. So the traditional workplace has primarily been represented by a physical building, but in reality, it always has been a living, breathing organism. And I think that's a very important thing that we need to remember. As much as our workplaces and where we worked was a major part of our identity, we have to accept that a workplace is a living, breathing thing. And if we accept that, then we must accept that the staff are the heartbeat, and we need to look after that heart. So we have a huge, again, job ahead of us to make sure that we can keep that moving forward. We have seen significant issues with retaining staff, particularly in health and social care and other sectors, given the stresses and the strains put on them over the past 20 months. And there is a challenge for us all to see how we can increase terms and conditions and also bring mental health and well-being to the fore in terms of workplace and workforce development. We also need to consider that we're not starting from a blank page in terms of the impact in Northern Ireland from mental health and from things like trauma. So our starting point was that we had 25% increased need for mental health services against a backdrop of 30% less resources to address those mental health needs. So the pandemic will expose those lack of resources further, and we will need our political representation and also our local government to ensure that mental health is prioritised moving forward. Next slide, please. I suppose this is a term, I just put this slide up. I've heard a few terms already today: hybrid, blended, new normals always thrown about there. And I suppose we need to consider is that it is a lot of change. And the one thing someone stuck in my head the other day that said to me was, the new normal is different for every single person. And I suppose that's the major adjustment and the flexibility that we will expect in workplaces moving forward, to try and adjust and address what the new normal means for every single individual. And it's a big challenge for workplaces and a big challenge for trade unions to work on. The other consideration we need to take is that people are saying, so this is how it's going to be, get on with it. And I'm very aware that we can't allow that to happen. There's a lot of work that needs to happen in terms of how we approach and how we deal with the emerging needs of the workforce, their mental health, and their physical health conditions. It is important that workplaces adapt to people as well as the pandemic, and the needs of people have changed considerably over the past 20 months, and that needs to be taken into consideration again when we focus on people's well-being. We do have a lot of catching up to do in relation to workplace well-being, and I think, you know, by working together, by coming up with new ways of working and focusing on how we can support individuals moving forward collectively is the way to go. Next slide, please. I wanted this slide just to highlight the increased pressures across all aspects of life, and it hasn't just been the workplace. We all know that, you know, people have been forced not to have no childcare. We've had the overlay of the pandemic and the needs of people and the demands put on people from COVID-19 and the impact that that's had. The changes within the workplace and the changes just within people's lives, and also the changes in well-being. I speak to a lot of people who were very active, for example, went to the gym, went to yoga classes. That was all taken away. And again, that is all just starting to open up and restart. And there is a responsibility on us to see how we can facilitate and help that. But in that gap, what we've seen is increases in anxiety, depression, a lot of stress, hopelessness, and as pointed out there, isolation, but also a development around financial worries and concerns around the future, reduced physical activity, as I said, and definitely negative coping in terms of alcohol use. So I suppose we need to look at that in a way that it's been enforced juggling. No one volunteered for this, no one wanted this to happen. A lot of people have been forced into their homes and work from their homes. And as you rightly say, it has worked for some and doesn't work for others. And that's a balancing act, I think, that we need to work out and ensure that we have policies and procedures moving forward to protect staff, as well as looking after their well-being. Next slide, please. So we have done an initial cost benefit analysis, and I suppose some of the costs that were coming up, definitely pointed out by Robert and earlier speakers, that reduced social connection, increased isolation for staff, reduced support infrastructure, so not having the same contact with the support infrastructures and the support services within workplaces. Definitely that blurring of the work and home life and the difficulties and challenges that that presents, and very much not being able to switch off. As Carmel highlighted earlier, the laptop being in a room brings your workplace into every room you are, and it's not just your laptop, it's all portable devices, all workplace provided devices like phones and tablets. And also definitely we see an increase now, as I said before, the burnout and the fatigue and the compassion fatigue within some staff. And again, we need to consider how and what approaches we need to take to address that. In terms of some of the benefits, definitely infection control. Research would tell us increased productivity from home working, the removal of travel time and that daily commute, and it's better for the environment, something that we're all very focused on at the minute, is that environmental footprint and issues around that. And cost savings for employees and employers in terms of travel time, lunches, and whatever else. And and a better work-life balance in some cases. And something other people have pointed out is that location independence. So they have moved away from cities and they are relocating into a more rural or wherever they want to go in terms of their lives. Next slide, please. So some of the early research into home working, some of the pros has been fed back, and some of the research has pointed that there is reduced conflict within the workplace, less travel and movement stress. Again, a good benefit for the environment there, but also that travel to and that daily commute has reduced some people's stress and anxieties around workplace travel. A better sleep to work ratio. Again, people are able to sleep longer because they're having to travel less, and also then work-related financial pressures. And as I said previously, the increased productivity and better work-life balances. Some of the cons that have been fed through our organisation that we track are the demands of the home environment, and very much so we see struggles with people who have competing issues around childcare, or they don't like working from home, they don't have the infrastructure, lower levels of organisational support. And an interesting one that came through was actually techno stress. So very much people saying an invasion of privacy, not being able to switch off, expected to be on Teams calls consistently, back-to-back meetings being scheduled because they don't have to walk between buildings. And you know, there are issues for workplaces to consider there around that invasion of privacy, but also then others talking about IT complexity, a lot of anxiety around management of some of the IT solutions that are being used, and making sure that they have the appropriate training is very important. Reduced work-related feedback and guidance, so reduced contact with management and managers. And one thing that came through quite clearly was lone working is lonely working, and people saying that that disconnect was definitely there for them. They weren't having the coffee or the walk to the shop with their colleagues and having a chat about things that were non-work related. And then constantly connected to electronic and contact portals has been flagged as another issue of concern. Next slide, please. So the key areas that we would like to see in terms of, and we would advise people to focus on in terms of supporting employee wellbeing, from an organisational perspective, what we would like to see is regular effective communication, and communication, as Robert highlighted and Carmel before, is so important. Their organisations communicate effectively with their staff, and they do feel communicated with. Further clarity of their role and their expectations if they are working from home compared to the office. Clearly defined performance measures. A lot of performance measures ceased throughout the 20 months because other priorities were there. So we'd like, you know, I think workplaces need to review their performance measures and communicate those effectively with their staff. Appropriate workloads. So what we've seen is that drift of, particularly within the health and social care sector, less staff. And what we need to be aware of is less staff doesn't mean more work for the existing staff. So we need to watch that drift. Doesn't mean that we're squeezing more and more out of the existing staff that are there. Training and assistance for managers, supervising for work at home staff. Definitely think there needs to be some training developed for that. Inclusion and access to systems and documents. A lot of people have commented on not being able to access things that they would have been able to access in the office, printers, for example, or things, documents around their policies and procedures. And we also would advise organisations to review their policies and procedures to include work at home needs, and to review their policies and procedures to address that. We would also advise organisations to look at and monitor wellbeing and how they can actually stay in touch with wellbeing as part of their supervision processes, and also then increase access to support through EAPs and other support mechanisms that organisations are subscribing to. But most importantly, it is about embedding a caring culture within an organisation or workplace. In terms of co-workers, developing systems which can facilitate effective formal and informal co-worker support, the provision of non-work related face-to-face online interactions, which we've seen and we've heard other speakers and other commentators talk around. And also, we need to think about that blended approach with some regular in-person meetings with managers and co-workers to make sure that that disconnect doesn't happen. And lastly, we need to consider the different approach needed to develop that term team and working in a team. And what does home working actually, or how does that impact on the development of teams moving forward? Next slide, please. The last two areas, just to look at our technical support. Again, issues that do come through are people who don't have appropriate equipment, and saying how much that does impact on stresses and strains on their well-being. So making sure they have all the equipment and the appropriate equipment to work from home, the training and development for the staff to use that equipment. As other people have pointed out, the DSE needs are met at home, and also that they have good access and good quality to connectivity in terms of broadband. And that's something, again, that a lot of workplaces have now looked at, how they can support. In terms of boundary management, providing clear expectations around the role, regular supervision with their staff, training for managers on how to formally develop boundaries in relation to that work and family life with their staff. And some people now are looking at email management. Some employers have restricted access to email accounts on certain times of the day. So when someone leaves work at 5 o'clock, the workplace isn't reaching into their phone or their laptops to work longer. Next. Okay. So I suppose just to finish off, I would like to say that the partnership between employers and employees has never been tested so much. We must ensure that that partnership now stretches to look after people's ongoing needs and well-being. I would like to thank you for the opportunity to speak with you today, and a particular thanks to Fergal for sharing his story, outlining the ongoing challenges in terms of his physical and mental health issues. We all have a responsibility to ensure we look after those who look after us all. So I would like to thank you once again for the job that you've all done in the past 20 months. Thank you.
Thank you very much, Alex. That was really well delivered. Thank you. Okay, our final panelist, and though she may not need introduction to a lot of you, is Margaret Loughran, who is the chairperson of our Health and Safety Committee for NIPSA. Margaret has about 20 years, did you say, Margaret, of experience as a health and safety rep? Slightly more. You don't look old enough. There's very little that Margaret doesn't know about health and safety, if anything. And what she doesn't know about reasonable adjustments isn't worth knowing. So I'll hand you over to Margaret now. Thank you.
Okay, good afternoon, everybody. So this is going to be a slightly different take on new ways of working. So we're going to look at the effect of the pandemic initially. So if you move just to the next slide then. So the pandemic in our workplace, it changed completely how we worked, where we worked, how we worked. And for some, it didn't change the workplace at all, but it did change the way that we worked. So it did. So for a lot of people who worked maybe in meat plants or areas like that, they had to attend work, but it meant for them that there was an extreme amount of additional measures that had to be put in place to protect them while they were working. For some people, they were literally sent home and given a laptop and said, this is where you're going to work. Some people were sent home and had no facilities to work. And some people then had, work areas had to adopt a blended approach because they had frontline services that they needed to deliver. And that blended approach then factors into the proposed then this hybrid way of working. So it does. And what we're looking at then is where all this has led to. So it is The way we worked also affected people significantly, because people who were susceptible to COVID, maybe because they were in that clinically extremely vulnerable category, or people who had disabilities. And in general, some people were just afraid of then actually having to go to work, or what going out even meant to some people. And this is impacted across the piece. So where we had some people who lost out on the ability to go to work and felt that they wanted to go to work, then some people who had home in a position where they had to work from home because they couldn't go to the office. And then we had some people in the mixture of all of this. You have all these vulnerable people, people with disabilities, and not knowing where their place was, because some of them maybe were being required to attend work, and some of them, you know, had a fear. Some people just had a fear, probably due to their age or whatever. And the age dynamic in the civil service and stuff has had a tendency to lean towards this, when you think, you know, that most people, a lot of the staff in the civil service are over a certain age group. Not that I'm over that age group, of course, like, but you know, there was all sorts of things that come into play. So if you move to the next slide then. Okay, so what has the pandemic meant to you? So I don't know about you, it has changed me. And I have to be honest, the reason I did this part of it is because I changed job in the middle of the pandemic. So I previously had been a training officer, was out going to hotels, delivering training sessions, massive interaction with staff from all sorts of areas. And suddenly, because of the pandemic, this type of work stopped, and I had no job. And then I had applied for a job before, and it came up, and I was going to be then moving to a completely different department. And the transition part of it was extremely difficult, because you were in a pandemic, everybody was working from home, and you needed to make that transition into this job without the level of contact that you probably would have had in normal circumstances. So I had to learn about people, who people were, literally by phoning them up and saying, okay, so you're this person, you're in charge of this. Can you tell me what your role is? And how then my role then fitted into the organization as a whole. And I was moving as a health and safety advisor in the middle of a pandemic, which was quite stark, you know, because there was very little information known about the pandemic at this point in time, other than literally, I mean, if you need to stay away from people, keep your hands clean, follow all these procedures, and literally, you know, the information was trickling out as you know, organizations became more aware and were able to give you that information. So you were trying to manage that all the time to make sure that you had the information you required, because you were giving that advice to people, and you wanted to make sure then that you were giving them the correct advice. Transitioning to a job in normal circumstances can be difficult enough, but transitioning to a new job in a set of circumstances where you haven't actually met anybody is really, really difficult. You know, and I was moving from an office-based environment into an agricultural-based environment. And, you know, my first question when I started work was, how could we safely bleed sheep? And I have to be honest, sheep to me were something you drove past if you were going to the beach for the day, and they were usually in a field somewhere. And I had to then investigate and do that. And a lot of it was on your own. And I have to be honest, I felt that, you know, that suited me. I'm that type of person. I like that sort of thing. But I have, as I've worked through different things, I've wondered, you know, how would that impact on other people in that circumstance? You know, how would they have managed that? Would they have been given adequate support to manage that? did I have all the tools and information I required then to take that forward? And while I have that type of inquisitive mind, and I do that, other people may not have taken that transition as well, and it could have been detrimental to them in the long run. So it could have. So I think when we're looking at the pandemic, there's a lot of things, that we have had to address. New ways of working are here, because office spaces are not built to allow for the measures that are required to protect staff and maintain the distancing to prevent transmission. They say that they need at least 90% of the population to be vaccinated to give that level of protection across the piece. But that can only apply if everybody can be vaccinated, because some people can't. Some people are afraid of being vaccinated, which is another issue. But, and some people have personal preferences, and those personal preferences are their rights. So there's a lot of factors that come into play then. And I think we all have our own individual perspective of how things are going and what things mean to us and what it means to go back to work. And some people want to go back to work. Some people are happy working at home. Some people would prefer that mixture of approach. So it is, and this has created a whole new development of how we work. So we'll just move on to the next slide. Okay, so what we're going to look at now is then just the role of the rep. So as health and safety reps, we're on the ground and we're there to ensure that management adhere to their statutory duty in respect of health and safety. It is vital across the piece that we tried in as many work areas as possible to establish health and safety committees. Raise issues with your management as they arise. You can advise on individual risk assessments to your members that you feel that they would require them, and highlight to management why then that these individual risk assessments should take place. You have the right as a rep to carry out inspections, observe risk assessment process, and challenge any inadequacies in proposed control measures. And it would be preferable that if you do this, that you do it in writing. And make representations, for example, on stress, well-being, communication strategies, how engagement takes place in the work areas, especially if this hybrid approach is taken forward. I could go on forever on the list of things that will probably present themselves to you at any point in time. But move on to the next slide, sorry. Workplaces that have active health and safety reps are safer places to work. And this is a fact. And I know that all the reps here today and the challenges that have faced them in the last 18 months and the challenges that will face them in the future, that they are well able to rise to those challenges and protect their members and other staff in their work areas in the same way that they have done up to now. Thank you.
Thank you, Margaret. And I'd like to take this opportunity to thank you so much for your support to myself, to the other reps on the committee, and also all the reps who I'm sure ask you plenty as well. You've been a real fount of knowledge for us, and I don't know what I would have done without you. And thanks to Geraldine as well. You've been great in getting anything we ask for. So we actually have you tormented as well. So thank you so much, Geraldine. We have a couple of questions here. Is there anyone wanting to actually speak as well? We have a couple of questions. The first one is, Hubs of shared departments will cause issues with health and safety representation and overlap between reps. This will have to be addressed. Who would like to speak on that? Maybe Carmel?
Yes, I'll take that one, Lorraine, if you don't mind. Essentially, what we have agreed with the management side is that the responsibility for the management of the hub will fall to the I suppose whichever organisation is in the majority of I suppose I was going to say inhabitant, not building, but inhabitant is not quite the right word. So whoever is mainly responsible for looking after the building. So for example, yeah, Ballykelly, it's largely a DAERA department or staffing building. And in that sense then, although there will be people from all over various departments, the responsibility will be DAERA's to look after that environment. And all the staff using that will have to abide by whatever is laid down by the health and safety reps, the trade union health and safety reps and the management in that building. And that will be the same across all the areas. Now there'll be some where they're well, the buildings may be entirely shared, and in that regard, then I would suggest that health and safety reps would work together. But in the main, it will be the responsibility of the key, I suppose, key holder in the building to look after it. There will, for those outside of the NICS, we are looking at some sites for hubs, or the NICS is looking for sites for hubs because we don't have enough NICS buildings in all the areas. So, for example, one of the areas that we would like to see a hub is in the Mid-Ulster area, which up to now the NICS hadn't been considering. So as a result of pressure from us, they're now considering one in Magherafelt. Now, there isn't an NICS building in Magherafelt, so they are looking to see if there's any council provision that they could use. There is NICS buildings, but none that could hold a hub. So they're looking potentially for council, you know, if there's a council building. So I mean, at the minute, the NICS hubs are purely for NICS staff, but at some point in the future, we may have mixed public service hubs. Now that can start to create potentially more difficulties because you'll have more employers and more health and safety reps and more individuals involved. But I think we can overcome them if in the main, the key health and safety responsibility in any of these shared areas is by the key tenant of the building, and the key holders within the building. And I think that would allow us to overcome any difficulties. Hopefully that answers the question.
That's great, Carmel. Thank you very much. The second is actually just an observation on rebuilding the economy from Andy Bowl. It says, my wife and I have been giving great support to our local businesses because we spend so much time working from home. Local shops are probably of greater importance than city centre shops.
Can I just come in on that one again, Lorraine?
Yeah.
Because I think that probably Andy's comment probably popped up at the point in time where I was saying that politicians are very eager to get some of us back to the office and spending money. And, you know, politicians, and I suppose some of the shopkeepers in the Belfast area have been very vocal in suggesting that we need to get the city centre shops and offices repopulated, civil service spending their cash. We've made the point that the money being spent locally is just as vital to the whole of the economy. So it isn't just businesses in the city centre. Now, obviously, we don't want to see cafes and restaurants and bars closing down. I mean, parts of our cities are already ghost towns in that regard. So we do want to make sure that, you know, that it's all shared around. But regional businesses are every bit as important, and local economies are now, I think, a bit more vibrant than they have been because civil servants have been decanted out and are not just in the big areas. But I do repeat the point that I made earlier, and hopefully politicians will eventually get the message that if they want more money spent in shops, business, and so on, then they need to put more money into the pockets of public sector workers because, as I said earlier, we've been undervalued and underpaid for far too long. The £100 voucher that everyone's getting to spend will soon be gone, and it is nowhere near enough to compensate us for the work that we've done, and is nowhere near enough to ensure that businesses that are potentially in trouble, get out of trouble. So we want to make sure that the economy is vibrant going forward in every area and in every part.
Thank you very much, Carmel. Okay, are there any other questions or anyone else wanting to speak? There's nobody else with their hands up. Oh, sorry, there's something just popped on now. Okay, someone has said, I had a recent issue where management made a mistake and then blamed a specific team. Despite them indicating the issue multiple times before it happened, to fix this mistake, they made the team go into the building and fix the work over the weekend under the threat of removing hybrid working if it wasn't done, causing intense stress. The managers themselves were working from home. Okay.
I'll maybe take that one too, Lorraine.
Okay.
I'm assuming if there's a reference to hybrid working, then it possibly a civil servant, although it's come up anonymous. That's shocking. I mean, I have to say it is truly shocking. And I would suggest if I'm assuming the person is a rep if they're here at the event, and I would like that to be raised with your departmental trade union side if you are in the NICS, because that's disgraceful. I mean, I don't know, Margaret, if you know any more about it, but I really genuinely think that that's shocking. So yeah,
I don't know anything about it, but I have to be honest with you. I would recommend the same approach, and that to threaten staff with the removal of hybrid working. Well, if hybrid working was just a hybrid working, and as a policy, but this is hybrid working due to a pandemic at this particular moment in time. It's under the recommendations of the PHA and the executive, and therefore is not within the remit of management to remove that, because it is literally a protocol that has been brought in to protect staff. So I'm sort of like wondering,
I've actually dealt with one very like this, but they ended up, they had to backtrack, but it was only brought to my attention after they'd already been told that they had to come
Can I say though, this isn't the hybrid working policy that's been agreed in the NICS is not the gift of individual managers or the gift of individual departments. This is a policy that's been negotiated centrally and has been agreed and is being signed off at the highest level. So both the outgoing head of civil service and the incoming head of civil service have both put their voice behind this policy. So it really isn't within the gift of individual managers to determine, what they're going to allow or not allow. And in fact, working from home and hybrid working is a default yes, unless the business area that you're working in can't allow it. And some of us can't, work from home. There is, I'll pick out the vehicle testers because I'm sure there are some on. I mean, you can't test a car from your home, and there are other bits and pieces of work that can't be done from home. A lot of our P&T colleagues can't do their work from home. But where it can be done from home, then the default is to allow and to develop a work style agreement that suits the individual. So managers, and I know that some of the worst of them out there, do occasionally threaten to withdraw all sorts of rights and conditions that we have, that NIPSA has won and argued for over the years. So the answer to them is no, you can't do it, and it needs to be challenged at the highest level within a department for those managers who are guilty of it.
Yeah, I think it's really important for to remind our reps that if there is an issue like this, you have to bring it forward. And that's the only way that we can do something with it. Because it's crazy that it's still happening. And also, if any of your managers, remember that you have to go by the guidance that has been that's been filtered down, and because any issues that we are having at the moment is where there's some sort of breakdown in communications in the middle. So it's not really helpful if it's not filtering down through the layers of management structure accurately or safely. Thanks very much. Are there any more questions? Or can I hand back to Margaret, please?
Lorraine,
Thanks, everybody.
You handled that very well for your first time.
I don't know, it would encourage, I know it's not very productive for health and safety, but I'm sure it would encourage day drinking, the stress.
Thank you, Darren.
I've only got water.
Moving on then, okay. So I'm going to call now on Geraldine Alexander to announce the result of the Health and Safety Committee election. Thank you, Geraldine.
Chairperson delegates Geraldine Alexander, scrutineer, to declare the results in the election for the remaining 8 seats on the NIPSA Health and Safety Committee. I can declare the following elected: Brendan Callan, Francis Dool, Lorraine Harton, Margaret Loughran, Damien McGlory, Marty McKee, Gerard McLaughlin, and Gerald McLernan. Thank you, Chairperson.
Thank you, Geraldine, and thank you very much for carrying out the process for the election campaign. I'd like to congratulate everybody who has been elected onto the Health and Safety Committee and look forward to the year ahead. There's many challenges ahead, and I'm sure that you will all be up to those challenges. I'd now like to call on Brian Smith, the NIPSA President, to close conference.
Thanks very much, Margaret. First of all, can I just say, wow, you've excelled yourselves as usual. I think the panelists that you got here today and the guest speakers were second to none. I think the numbers involved reflect that, and the fact that the graveyard shift didn't see a whole drop down. So congratulations to you and the committee, and I know Margaret or Geraldine plays an active part in that in the background. A number of people have commented on this, and I think I feel compelled to. Fergal, I've messaged you privately. That was an amazing sharing of your story, and thank you for having the courage to do that. I think it'll inspire people because you not only get through it, but you're still out there fighting a good fight, and fair play to you. But worrying that 10% of COVID, as opposed to the figures elsewhere, as talked to by Diane, because I believe I've spoken to a number of individuals who actually think they've had COVID, they've never been tested, there's no mechanism for doing that, and they're suffering. The themes you just picked today, I think, folks, were very, very important. Long COVID vaccination, hybrid working and mental health of workers, and a series of speakers set out the difficulties. Carmel alluded to some of the hybrid work in appropriate space. We talked about connecting with others. We talked about the whole Chinese curse. That was fascinating. Looking forward to reading up a wee bit more about that. A traditional workplace is actually a living, breathing organism. I haven't thought about that before. Today, there's calls for the booster jab to be stepped up, because those of us that chose to do it, to get the double vaccination, they say are now waning, and the figures would show that and reflect that there seems to be a significant increase. I think when Margaret talked about offices are not designed to accommodate the current pandemic, and they're not. I honestly believe that those themes of that you have looked at today, which we fought with them or struggled with them at the early days 20 months ago, it seems unbelievable that we're still here. I do believe that over the coming years, we're still going to be dealing with these, because day and daily, management will try and impose their own ways of working. We leave people with the difficulties of not having the space or the plugs or the right equipment. We have that, I want to be in work, I don't want to be in work. And I commend you all for the amazing work that you've done to date. And I honestly believe that you need to build your stamina for the future going forward. Congratulations to the newly elected persons. I wish you well. I know there's a wealth of resources there today that were shared with people, and I know you'll be calling upon those, and certainly we'll be calling upon you in our own respective workplaces right across to seek that expertise and guidance that you've so diligently done. So very well done today. Sorry I missed the start of it. It was another meeting. I missed the presentations, but I'm sure that went very well too. So it was great to be part of this, and I wish you all well. And maybe next year it'll be actually people in persons as opposed to the I can't remember the word you call it, the virtual, couldn't think of that word, the virtual bit, but good luck to you all and take good care.
Thank you, Brian. Okay, so before we go, I'm just going to advise you that Journaling is preparing an evaluation form, and it will be issued to everybody after conference. I have taken a note. There was a few questions that weren't able to be answered in this morning's session, and if we can get answers to those, then we will get them sent on as well. But before leaving, as with every year, I'd like to thank all the reps who have been able to attend here today, all the health and safety reps who have not been able to attend here today, for the work that they have done tirelessly over this almost 2 years now we're into this, the work that they've done on the ground, the representations they make for the staff in their areas, the work that they do to maintain their workplaces and keep people safe. I'd like to thank all the panelists. I think the panelists have given us a lot of information that will help us in the future to carry out our roles as reps on the ground. And needless to say, before we go, keep safe, keep your distance, wash your hands, and let us all be safe, get into the future. Thank you, conference. And I'd like to close conference.